Hemoglobin is 10 grams per deciliter. We know already because the patient is suffering from symptoms of anemia as well. Leukocytosis मतलब WBC कम है या ज्यादा है पेशेंट में? डेफिनेट. तो ल्यूकोपीनिया क्या होता है बच्चों? तो ऑसिस का मतलब क्या होता है जस्टिन? ज्यादा. पीनिया का मतलब क्या होता है? कम. So WBCs are more in this patient. So leukocytosis means increased WBC count. Along with that, the platelet is 3 lakhs per cubic millimeter. Normal platelet count is between 1.5 to 4 lakhs per cubic millimeter. The normal platelet count. Peripheral smear shows metamyelocytes. These are nothing but precursor forms. ठीक है? Precursor forms of finally the myelocytes. So metamyelocytes are 15%, promyeloblasts are 30%, and myeloblasts are 45%. So now myeloblasts are mature forms or immature forms. I hope all of you are quite aware. Hematopoietic stem cells होते हैं bone marrow में. They are of two types. One is called as the myeloid lineage, another is called as the lymphoid lineage. Myeloid lineage से आगे जाके क्या बनेंगे? Erythrocytes. That is nothing but your RBCs. Megakaryocytes. That is nothing but your platelets. And finally, granulocytes. Three types of WBC: neutrophils, eosinophils, and basophils. And along with that, monocytes also. Whereas if I talk about the lymphoid lineage, it forms what? T lymphocyte, B lymphocytes, and the NK or the natural killer cells, right? If the leukemia arises, if the cancer arises from myeloid lineage, it is called as myeloid leukemia. If it arises from lymphoid lineage, it is called as a lymphoid leukemia. The number of blast cells or the number of immature cells is 20%. Usually, it is a chronic leukemia. If the number of blast cells is more than 20%, that means it is a acute leukemia. Basic scene समझ लो. What is leukemia? Cancer or malignancy of WBC. क्या होता है? There is more and more and more rapid division of WBC inside the bone marrow. अब में क्या difference है? Acute will be very aggressive, very stormy onset. बहुत जल्दी होगा develop. तो इस कंडीशन में क्या होगा? WBC proliferation या WBC का cell division ज्यादा होगा या कम होगा? ज्यादा होगा. If it is very rapid now, will it get enough time to mature? No. Therefore, the immature cells are kicked out first inside the blood, even without maturation. So chronic में भी होता ही है, but chronic में at least it has some time for maturation. So there more number of mature cells are seen in the peripheral circulation. But in acute leukemia, there is no enough time for maturation. Therefore, more number of immature cells, blast cells are seen in the circulation. So that's the reason more than 20 acute leukemia, less than 20% blast cells, chronic leukemia. Important is here definitely, please remember myeloblasts are 45% usually. Important is it can be a case of acute myeloid leukemia, but important is in a case of chronic myeloid leukemia also, please remember, because in acute myeloid leukemia, we do not have moderate to massive splenomegaly. In cases of chronic myeloid leukemia also, I hope all of you are quite aware, there are three phases, right? First is the chronic phase, then it goes into the accelerated phase, and finally it lands up into blast crisis. Very good. So when the patient will be in blast crisis of chronic myeloid leukemia, the number of immature cells or the number of blast cells will be very, very, very high. Okay, so there is an exception where the number of blast cells can be more than 20% even in a chronic myeloid leukemia also, and that is nothing but the last stage of CML known as blast crisis stage. इसका मतलब बहुत ज़्यादा blast आ गया, ठीक है? Which of the following is the diagnosis? What is your answer now? Right? Because definitely the age group CML is more common in adults patient between 50 to 60 years of age group. Along with that, the most important symptom is massive splenomegaly in the patient, anemia, thrombocytopenia. ये सब में होता है. These are the characteristic symptoms which will help you pick it up. And definitely myelocytes are also seen, promyeloblasts and myeloblasts are also seen. I have ruled out AML because my massive splenomegaly is not a feature. Okay, so that's the basic important thing. Important is in a case of CML, if I do a bone marrow biopsy, what will be seen even on a peripheral circulation or a bone marrow biopsy? This kind of appearance is seen. क्या दिख रहा है? You can see the neutrophils also, many neutrophils. You can see these eosinophils as well. You can see the basophils as well. A lot of granulocytes are seen, right? So this is what is called as very good garden party appearance. Because हर तरह के cell दिख रहे हैं ना तुम्हें. So this is the classical garden party appearance which is seen in cases of chronic myeloid leukemia. So which appearance on bone marrow biopsy or peripheral blood smear is seen in chronic myeloid leukemia? गार्डन पार्टी अपीयरेंस, अलग अलग कपड़े पहन के आए ऐसा लग रहा है ना, so that's important, garden party appearance. Whereas this is a bone marrow biopsy or peripheral blood smear of which condition, anybody? What are these cells called as? Very good. It is a peripheral blood smear or a bone marrow biopsy of CLL. What is CLL? Chronic lymphocytic leukemia. What are these cells called as? Shabash. These are known as the smudge cells. Also can be called as parachute cells or the basket cells as well. Okay, these are known as parachute cells or the basket cells also. So smudge cells usually are a feature of chronic lymphocytic leukemia. No issues with this, anybody? Okay. Chronic lymphocytic leukemia is also more common in elderly. तो बस एक ही ल्यूकीमिया बच्चों में कॉमन है, आंसर इज स्ट्रेट अवे ALL. तो अगर बच्चे में ल्यूकीमिया की बात चल रही है, योर आंसर इज वेरी इजी ALL. Adults में है, then you need to look for symptoms and all the other features as well. CLL में usually massive splenomegaly वगैरह नहीं होती. Here the patient will have lymphadenopathy along with hepatosplenomegaly. Important is, apart from all these features, the patient also has usually weight loss and fever. So these are important symptoms. Weight loss and fever भी दिया जाता है in a case of chronic lymphocytic leukemia. That will help you to make a diagnosis. No issues with this, anybody? Have you understood? And अगर ALL या CLL की बात करनी होती, would they have given myeloblast or myelocytes in the option? No. In the question, they would have mentioned about lymphocytes or lymphoblasts. So that is the reason I can easily rule out ALL and CLL both from the options itself. ठीक है? No issues with this. Drug of choice बता दो CML के लिए. Very good. Okay, why? Because what is the translocation associated with CML? Very good. Sarkari question of your exam. It is translocation 922. This translocated 922 chromosome is known as which chromosome, anybody? Philadelphia chromosome. And it is showing which gene translocation, anybody? BCR ABL1. Okay, so it shows the BCR ABL1. ये भी question आ चुका है, ठीक है? So it shows the BCR ABL1 gene translocation. Okay, so that's the important. And इसकी वजह से क्या हो जाता है? The tyrosine kinase enzyme is activated. And क्या रोल होता है tyrosine kinase enzyme का? It favors cell division. तो जितनी ज्यादा tyrosine kinase enzyme activate होगी, उतना ज्यादा cell division होगा. And that's why there is cancer in the patient or chronic myeloid leukemia. So drug of choice will be tyrosine kinase inhibitors. Drugs like imatinib. If the patient is resistant to imatinib, then the drug of choice should be bosutinib. GIST का आंसर मत बताओ. In GIST, definitely the drug of choice is imatinib, but resistant to sunitinib देते हैं. यहाँ पे drug of choice is imatinib. If the patient is resistant to imatinib, then we will give bosutinib. All tinib group of drugs are tyrosine kinase inhibitors. This was a previous year question. याद रख लो अच्छे से, ठीक है? CLL के लिए drug of choice, anybody? What is the drug of choice? Very good, बोलो. It is fludarabine. Okay, it is fludarabine usually. FCR or PCR regime is followed. Fludarabine, cyclophosphamide and rituximab. Or PCR is pentostatin, cyclophosphamide and rituximab. Remember, fludarabine is the drug of. So jaldi say drug of choice for CML, imatinib. Drug of choice for CLL, fludarabine. No issues with this, anybody? Chalo. Question number 14. Easy question. A speech gathering on a particular topic with 4 to 6 experts on stage. Which mode of health communication it is? ये question मैं TND में पहले discuss कर चुका हूँ. What did I tell you? What they are saying, it is a speech gathering. Are they saying there is discussion among the experts? No. Speech gathering का मतलब क्या होता है? एक के बाद एक बंदा speech देने जाएगा. These 4 to 6 experts are sitting on stage, but does not necessarily mean they are having discussion among themselves. Have they mentioned they are having discussion among themselves? No. They have mentioned it is a speech gathering. That means one after another, the person or the expert will go and give his own speech usually. तो एक के बाद एक speech दे रहे. There is a set order of speeches. Okay. Usually the speeches are prefixed. इसमें spontaneous कुछ नहीं होता है. Okay. So this is what, anybody? Symposium. Very good. Because there is no discussion in between the experts. So this is a series of speech usually, or a speech gathering is a symposium. Panel discussion usually ये नहीं होता है any which ways. ठीक है? तो जो दिखाया जाता है ना, so this is the panel discussions, but not really. तो usually हाँ, तो panel discussion में बोलने का मौका दिया जाता है जो ये लोग नहीं देते any which ways. There are 4 to 6 experts, but what is the basic difference between symposium and panel discussion? Important is in panel discussion, the experts will have discussion among themselves on a particular health related topic. But in symposium, they will have a single health related topic, but they will go for a speech one by one. दोनों के दोनों in front of audience will happen. Both will happen in front of audience. Okay? No issues with this, anybody? That's important. Which is the best method of health communication? This was a previous year question. Very good. It is interpersonal communication. Catch it. It is interpersonal communication. That is face-to-face communication or one-to-one communication. Doctor-patient relationship जो होता है, ठीक है? Followed by that, the second best one is FGD. That is focused group discussion. Question on focus group discussion. How many number of participants are recommended in a FGD? So the number of number of participants in a focus group discussion should be between 6 to 12. This was a recent FMG question. Okay, number of participants in a focus group discussion should be between 6 to 12. Okay, at the end of the focus group discussion, such kind of a diagram is formed. That is called as sociogram. One of them is the leader who starts the conversation. जैसे तुम medical officer हो, तुम multipurpose workers से बात कर रहे हो, ठीक है? Whereas one of them is a recorder who draws this diagram. Next, what is this method? It is demonstration. Demonstration is one-way method or two-way method, Socratic or didactic? It is a two-way method of communication, that is Socratic method of communication. Why? Because after demonstration, the Q&A, the question and answer session is allowed. The ideal audience size for demonstration is 25, usually less than 25. Okay? So it is used for ORS preparation, counseling, for these things. No issues with this, anybody? That's important. Question number 15. A patient who is a resident of Bihar came to the OPD with history of diabetes and complaining of multiple sinuses discharging in the foot usually. What are they are discharging? They are usually discharging pus itself. Okay. Below given images there. What is the condition? Identify the condition. So it is the case of very easy Madura mycosis. Okay. So Madura mycosis, also called as Madura foot usually, also known as, most important, mycetoma. It is also known as mycetoma. Mycetoma can be of two types. The bacterial version is known as actinomycetoma and the fungal version is known as eumycetoma. Please remember. So bacterial is actinomycetoma and fungal one is eumycetoma. More severe is, very good. The fungal one is more severe. It also causes osteomyelitis or damage of the bone. Therefore, the treatment for eumycetoma will be always amputation. But for actinomycetoma, the treatment can be antibiotics because the patient will respond well to antibiotics also. Color ke granules important hota hai because in image in the question it will be helpful for you to pick it up. Actinomycetoma, which color granules are usually seen? Yellow, white or red color granules, right? Actinomadura pelletri, red color granules, na? So yellow, white and red. But in fungal, black and white. Okay, so black and white color granules are seen in eumycetoma. No issues with this, anybody? That's the important thing. Okay, this is Madura mycosis, Madura foot or mycetoma. Okay, so these are the multiple pus discharging sinuses. Usually, this can be a case of actinomycetoma because if there are multiple sinuses discharging pus, it is actinomycetoma. Single sinus discharging pus, it is usually eumycetoma. Okay, so that's the basic difference. Okay, no issues with this, anybody? Gas gangrene is caused by which organism, anybody? Clostridium perfringens. And the treatment of choice for gas gangrene is also amputation itself. That we have discussed already in surgery itself. Okay, chronic osteomyelitis usually. What is the common cause? Staph aureus. Very good. And athlete's foot is also known as tinea pedis usually. And tinea pedis, okay? So it is also known as athlete's foot. The image गायब है. ये screenshot है तुम्हारे solutions का ही, snaps का. ठीक है? तो tinea is also known as tinea versicolor, also known as pityriasis versicolor. Pityriasis in literal terms means scaling. जहां जहां pityriasis होता है वहां scaling होगी. Please remember that. ठीक है? And what is the causative agent of pityriasis or tinea versicolor? Malassezia furfur, or the another agent is Malassezia globosa. Please remember, usually if we take the scraping from the scales and add 10% KOH mount, so it will show which kind of appearance? spaghetti and meatball appearance. Tinea is a bacteria, virus, or a fungi? Fungi. Therefore, what is the universal culture media for fungi? Culture media. KOH is a mount. SDA, shabash. It is sabarodes, dextrose, agar. So universal culture media for all funguses is SDA, sabarodes, dextrose, agar. On that, it will show which kind of colonies? Fried egg colonies. So fried egg colonies are seen with which fungus? Tinea. But fried egg colonies are seen with which bacteria? Very good. Mycoplasma pneumoniae. Please remember. And fried egg cell appearance on brain on biopsy from a tumor are seen in which tumor? Very good. Oligodendroglioma. No issues with this, anybody? That's the important thing you need to remember. Tinea can also cause tinea unguum, that is infection of nail. Tinea manum, that is infection of hand. Tinea cruris, that is infection of groin या pubic region, also known as jock itch or pubis itch. Most important, tinea capitis. Tinea capitis is infection of the scalp. Tinea capitis is of two types. One is carrion. There will be a boggy, painful scalp swelling. And second, yellow colored cup shaped crust, favus. Yellow colored cup shaped crust known as favus. Causative agent of favus is trichophyton, Sean Lenny. Very good. Okay, so the causative agent of favus is trichophyton, Sean Lenny. Whereas for carrion, it is trichophyton, mentagrophytes. For carrion, it is trichophyton, mentagrophytes. Can also be called as trichophyton verrucosum. It is one and the same thing. No issues with this, anybody? At least carrion और favus के याद रख लो, ये previous question थे भाई, ठीक है? तो कम से कम उनके याद रख लेना. No issues with this. Moving further. Question number 16. A patient presents with hernia in the groin region. Usually in the groin region, if they are talking about hernia, either it can be an inguinal hernia or it can be a femoral hernia. Clinical examination reveals it is a reducible hernia, so it is not an emergency, which is above and medial to the pubic tubercle. Siemens test, also known as the three-finger test, reveals it arises lateral to the inferior epigastric vessel. The defect from which this hernia arises is present in which layer of abdominal wall? Provisional diagnosis. कौन सा hernia है ये? Shabash. First of all, when they have said it is above and medial to pubic tubercle, it was to differentiate it from? Very good. So pubic tubercle is a landmark which differentiates inguinal hernia from femoral hernia. If the hernia is above and medial to the pubic tubercle, it is a inguinal hernia. And if the hernia is below and lateral to the pubic tubercle, it is a femoral hernia. So to differentiate between inguinal and femoral hernia, we have the pubic tubercle as the landmark. Second, the landmark to differentiate, there are two types of inguinal hernia, indirect and direct. To differentiate between both of them, we have the inferior epigastric vessels, inferior epigastric artery and vein. Okay, if the hernia is lateral to the inferior epigastric vessel, it is indirect inguinal hernia. Whereas the hernia is medial to the inferior epigastric vessel, answer is direct inguinal hernia. Our hernia was above and medial to pubic tubercle, so it was a inguinal hernia. That is confirmed. Next, on Siemens test, it is seen it is lateral to the inferior epigastric vessel. So if it is lateral, it is a case of indirect inguinal hernia. Now, indirect inguinal hernia arises from, so very good. Indirect inguinal hernia is a protrusion or a herniation from the deep inguinal ring. And deep inguinal ring is a defect in which layer of the abdominal wall, बच्चों? Very good. It is transversalis fascia or the fascia transversalis. ठीक है, तो इतना ही पूछना था, बट कितना घुमाया, ये एनाटॉमी का क्वेश्चन है, बट अप्लाइड एनाटॉमी इसी को बोला जाता है. ठीक है, सो दैट्स द इंपॉर्टेंट थिंग. तुम बोलते हो कि पेपर 2 के क्वेश्चन पेपर 1 में नहीं आते, ये अप्लाइड एनाटॉमी है. ये एनाटॉमी बीडीसी में मिलेगा, ग्रेज में मिलेगा, हर एक में मिलेगा. ठीक है, सो दैट्स द इंपॉर्टेंट थिंग. रिमेंबर, inguinal ring has inguinal canal has two rings. One is called as the deep inguinal ring and second is called as the superficial inguinal ring. Okay, deep inguinal ring is a defect in which layer? Transversalis fascia, whereas superficial inguinal ring is the, बराबर बोलो तो सही फिर. Superficial inguinal ring is a defect in the external oblique aponeurosis. It is a defect in the external oblique aponeurosis. This has been a recent NEET PG as well as FMG question. दोनों अच्छे से पता होना चाहिए. Deep inguinal ring, transversal fascia, superficial inguinal ring, external oblique aponeurosis. No issues with this anybody? याद रखना. Indirect inguinal hernia arises from which ring? Deep inguinal ring. Whereas direct inguinal hernia arises from which structure? Shabash. It is the Hasselbalch's triangle. Okay. So please remember, direct inguinal hernia does not arise from any inguinal ring. It direct comes out from the abdominal wall, from the Hasselbalch's triangle, which is a weak area in the abdominal wall. कोई दिक्कत नहीं है इसमें. चलो. Which type of, ये सरकारी क्वेश्चन आ गया वापस, 3 बार रिपीट हुआ एग्जाम में. Which type of joint is present in the aloe mark shown in the given image? What is this joint, the blue color joint? So both of these are the pubic bone, and this joint is nothing but the pubic symphysis. If I talk about the classification of joints, तीन question आते कभी कभी एग्जाम में. So be sure with your joints. ठीक है? There are 3 varieties of joint. The one which does not move at all. Okay? Non-movable joints are called as fibrous joints. Slightly movable joints are called as cartilaginous joints, and freely movable joints are called as synovial joints. Important. Fibrous joints which are there, they are called as arthrosis. Cartilaginous joints which are there, they are called as amphiarthrosis. And synovial joints which are there, they are called as diarthrosis. Please remember that. They can use these terms. Now, fibrous joints which are not movable, they are of 3 types. The one between the 2 cranial bones are known as sutures. Okay, between 2 parietal bone, kaun sa suture? Sagittal suture. Between parietal and frontal bone, coronal suture. Very good. Between parietal and occipital bone, lambdoid suture. So these are the types of suture. Next is syndesmosis. Syndesmosis is present of interosseous membrane between the 2 bone. अगर 2 bone को जोड़ने वाला कोई membrane हो, that joint will be called as syndesmosis. Which joint is a syndesmosis? Which one? Superior, middle, inferior? So it is the middle radioulnar joint. Okay. Apart from that, which tibiofibular joint? So please remember, superior and inferior tibiofibular joint. ये याद रखना है. Okay. तो याद रख लो, middle radioulnar joint along with superior and inferior tibiofibular joint. These are examples of syndesmosis because both these bones are connected with the help of a interosseous membrane. Next, the third type of fibro joints are called as gum fosses between the tooth and its socket. That is the gum fosses. Next is the partially movable joints known as cartilaginous joints or amphiarthrosis. They are of 2 types. Primary cartilaginous joints are called as synchondrosis, and secondary cartilaginous joints are called as symphysis. What is the best example of synchondrosis? Anybody? Best example of synchondrosis. First sternocostal joint. Costa is nothing but rib. तो पहली rib और sternum का जो joint होता है, it is a primary cartilaginous joint known as synchondrosis. So first costosternal joint, then the joint between the epiphysis and the diaphysis. The joint between the epiphysis and the diaphysis. Okay, the physeal plate. It's also an example of primary cartilaginous joint or synchondrosis. Next, secondary cartilaginous joint, also known as symphysis. Best example is pubic symphysis. Apart from that, the another example can be intervertebral disc, the joint between the 2 vertebra. The intervertebral disc is also an example of secondary cartilaginous joint or symphysis. Last are the freely movable joints known as synovial joints, also known as diarthrosis. They are of 6 types. First one is called as the plain joint. Okay, first one is called as the plain joint, also known as gliding joint, because one bone glides or slips over another bone. These are intertarsal and intercarpal joint. 2 tarsal bones के बीच में या 2 carpal bones के बीच में जो joint होते हैं, these are plain or gliding variety of joint. Next is hinge joint. What is the hinge joint? Which will allow unidirectional movement. एक ही direction में movement जिसमें होगा, that is a hinge joint. Best example is the elbow joint. Next is the knee joint. Is a compound joint. It has 3 types of joints over there, so it cannot be a hinge joint. अगर compound joint option में है तो mark it as the best answer. नहीं है तो तुम hinge joint पे जा सकते हो. Otherwise it is a compound joint. ठीक है? Elbow joint. Second is the ankle joint, and third are the interphalangeal joints. The PIP, PIP एक ही डायरेक्शन में मूवमेंट होती है ना, उल्टा ले जा सकते हो क्या इसको? नहीं. So elbow joint, ankle joint, and interphalangeal joints. All these are examples of hinge joints. Then next is pivot joint. Pivot when one bone rotates over the another bone. When one bone rotates over the another bone. हाँ बोलो. एंकल यूनिडायरेक्शनल है क्योंकि एक ही डायरेक्शन में मूव होता है, हम एक्सटेंशन पूरा नहीं कर सकते. ओके, एल्बो में भी तुम एक्सटेंशन करते हो. इन्वर्जन यूनिडायरेक्शनल इन द सेंस यू आर नॉट एबल टू परफॉर्म अ कंप्लीट एक्सटेंशन. यू आर ओनली एबल टू परफॉर्म, क्या बोलते हो तुम, प्लांटर फ्लेक्शन और डॉर्सी फ्लेक्शन, दोनों फ्लेक्शन है. इज इट एक्सटेंशन ऑफ एंकल जॉइंट? नो. सो दैट इज अ यूनिडायरेक्शनल मूवमेंट. ठीक है, सो दैट्स इंपॉर्टेंट. नेक्स्ट इज पिवोट जॉइंट. पिवोट जॉइंट व्हेन वन बोन रोटेट्स ओवर अनदर बोन. एग्जांपल विल बी, best example is the C1 C2 joint, that is joint between the first and the second cervical vertebra, also known as atlantoaxial joint, which helps you in nodding movement of head. Also superior and inferior radioulnar joint. Radioulnar joint, this helps in supination and pronation. These are also examples of pivot joint itself. Next is the condyloid joint. Okay, condyloid joint is also called as condylar joint as well. Condyloid, or the ellipsoid joint. Best example temporomandibular joint. Okay, so temporomandibular joint is the best example of condyloid or the ellipsoid joint that has been asked. Saddle variety or sellar variety of joint. Best example to remember, first carpo-metacarpal joint. Okay, between the carpal and the first metacarpal, this joint is what is the saddle or the sellar variety of joint. And last is the ball and socket joint, when ball of one bone articulates with the socket of another bone. Best examples will be shoulder and hip joint. So shoulder and hip joint are examples of this one. जल्दी से रिवाइज करना चाहते हो? जल्दी से. Fibrous joints are also called as synarthrosis. Cartilaginous joints are also called as amphiarthrosis, and the synovial joints are also known as diarthrosis. Fibrous joints or synarthrosis can be of three types. Between two cranial bones is known as sutures. When there is interosseous membrane between bones, it is known as syndesmosis. Between tooth and socket, it is known as gum fosses. Please remember, syndesmosis ka best example, which radioulnar joint? Middle radioulnar joint. And superior and inferior tibiofibular joint. Next is your cartilaginous joints or amphiarthrosis. They can be primary or secondary. Primary cartilaginous joints are called as synchondrosis. Secondary cartilaginous joints are called as symphysis. Okay, primary cartilaginous joint or synchondrosis ka example is the first sternocostal joint, whereas the joint between the epiphysis and the diaphysis. Secondary cartilaginous joint, also known as symphysis. Best example is pubic symphysis, and second best is intervertebral disc. Synovial joints, also known as discs. There are 6 types. First one is known as plane joint. Second is hinge joint. Third is pivot joint. Fourth is condyloid joint. Fifth is saddle joint, and sixth is ball and socket joint. No issues with this, anybody? That's important. Ab batao, symphysis is fibrous cartilaginous, synovial cartilaginous. Primary or secondary? Secondary. So secondary cartilaginous joints are known as symphysis. आगे बढ़ते हैं. Question number 8. A patient underwent a surgical treatment for the below given swelling. What is this below given swelling, anybody? Shabash. So ranula is a swelling which is formed in the floor of mouth. It is due to collection of excess of mucus. So it is a mucus extravasation cyst involving which salivary gland? Very good. It involves the sublingual salivary. Transillumination test, जब हम torch मारेंगे, it will be brilliantly transilluminant. So transillumination test will be positive or negative? Positive. So transillumination test is positive. Now, what is the best treatment for ranula? Incision and drainage. Recurrence नहीं होगा. ऐसे मत करो जब सर्जरी मैंने पढ़ाई हो, प्लीज. शाबाश. Surgical excision. Marsupialization had chances of recurrence. I told you. Second best treatment is marsupialization. The best will be remove it now completely. Surgical excision, that is excision or removal of the cyst along with the sublingual gland. Both has to be done. Okay? Followed by the second best will be marsupialization. Important is now when you are performing surgical excision, guys, we have seen there are two important structures which are at the at the base of the sublingual gland. One is the submandibular duct, and second is which nerve? Lingual nerve. So if they ask you which is the most common nerve injured during surgery, during this surgery, during the sublingual gland surgery, which is the most common nerve injured? This was the question. It is the lingual nerve. Lingual nerve is a branch of. Very good. It is a branch of trigeminal nerve. Which branch? Mandibular division. Okay, so lingual nerve is a branch of the trigeminal nerve. Then if they ask you, this was the most common nerve injured during surgery. But if they ask you which is the most common structured injured during this surgery, then your answer should be submandibular. So jaldi say, during excision of ranula, which is the most common structure injured? Submandibular duct. Which is the most common nerve injured? Lingual nerve. Okay? So now, during the procedure, lingual nerve was damaged. Which of the following statement is not correct regarding the injury? So, option A says sublingual gland secretions are reduced. Okay, will it happen? क्यों नहीं होगा रे? So important is जल्दी से बताओ दो secretions कौन कौन करवाता है? Parotid gland, largest salivary gland is parotid gland. Parotid glands receive secretomotor fibers or supply from nerve supply from auriculotemporal nerve, which is a branch of mandibular nerve again, and second is the glossopharyngeal nerve. These are the two nerves supplying the parotid gland. Next is the submandibular and the sublingual gland. For submandibular and sublingual gland, guys, the supply is by the lingual nerve and branches of lingual nerve तो branches ही होगी ना भाई. Branches of the facial nerve. Please remember branches of facial nerve. These will supply the submandibular and the sublingual gland. So if lingual nerve is damaged, will there be decreased secretion from sublingual gland? Yes, there will be decreased secretion from the sublingual gland. That's a true statement. Option B says proximal 2/3 of the tongue taste sensation will be lost. So important is बराबर है या नहीं है? So usually, please remember, if I divide the tongue into three parts, the anterior 2/3 of the tongue, okay, the posterior 1/3 of the tongue, and the posterior most part of the tongue. Usually they refer to it as the vallecula also. ठीक है? तो now कैसा है? Nerve supply ये बहुत important है. Tongue is very important from anatomy. 5, 7, 9 and 10. ऐसा लिखते हो ना? तो usually from anterior 2/3 of the tongue, general sensations are carried by lingual nerve, and lingual nerve is a branch of mandibular division, and mandibular division is a branch of trigeminal nerve. These are responsible for general sensation, that is touch, temperature, pain and pressure. But taste sensation is carried by branch of the facial nerve known as cauda tympani nerve. Then posterior 1/3 of the tongue usually. Okay, general as well as taste sensation both are carried by pharyngeal nerve, that is your ninth cranial nerve. And from posterior most part of tongue, that is vallecula, both general as well as taste sensation both are carried by vagus nerve, that is your 10th cranial nerve. तो tongue को sensations देने वाली कितनी nerve? 4, 5, 7, 9 and 10. Easy. Vallecula में दोनों sensations, 10th nerve. Posterior 1/3 में दोनों sensation, 9th nerve. But in anterior 2/3, taste sensations are carried by cauda tympani nerve, which is a branch of facial nerve, and general sensations are carried by lingual nerve, which is a branch of trigeminal nerve. कोई दिक्कत नहीं है इसमें. Going back to your question, proximal 2/3 tongue sensations will be lost. Is it true? Proximal 2/3 के tongue taste sensation will be lost बोला है ना बच्चों? क्या हुआ? क्या बोलना है? हाँ हाँ क्या? हाँ तो ऑब्वियसली बराबर है ना, हाँ वही बराबर, वही बोल रहा हूँ, आ रहा हूँ मैं. So proximal two-third of the tongue sensation, tongue taste sensation is lost. It is not the taste sensation, it is the general sensations which will be lost. Option C says sensation at the floor of mouth is lost. That's a true statement because lingual nerve is known to innervate or it is known to supply the floor of mouth. Now here there is a problem. Yes, दो answers, दोनों में से कुछ भी mark किया होगा. You are right. Tongue deviated to the affected side. This is also wrong. The reason is tongue will be deviated to the affected side when the motor nerve supply is damaged. And what is the motor nerve supply of the tongue? It is the hypoglossal nerve. That is your 12th cranial nerve. So that all the muscles of the tongue are usually supplied by the 12th cranial nerve except palatoglossus. Palatoglossus is supplied by the pharyngeal plexus. Okay? All other tongue muscles are supplied by hypoglossal nerve or the 12th cranial nerve. So this was the recent question. If the 12th cranial nerve or the hypoglossal nerve of is damaged, the tongue will be deviated because एक साइड के मसल काम कर रहे, दूसरे साइड के मसल काम नहीं कर रहे. Tongue will be deviated to the same side of the lesion or to the opposite side of the lesion. It will be deviated to the same side or the ipsilateral side of the lesion. Matlab, if my right-sided hypoglossal nerve is damaged, my tongue will be deviated to the right side itself, the same side of lesion or injury. It will be deviated to. Okay? So that's important to be remembered. Very common and important question. तो दोनों में से कुछ भी आंसर होगा. You are right. B or D. ठीक है? आगे बढ़ते हैं. Question number 19. A patient is brought to the casualty with history of snake bite. Classical feature है ophiusis का. ठीक है, with features like bilateral drooping of eyelids. Drooping of eyelid is called as ptosis. So the patient is having bilateral ptosis. There is muscle weakness in the patient and there is frothing from mouth. During course of the treatment, the patient expires. The accused snake's photo was captured by relatives as shown in the image. What could be the cause of death in this case? What is the snake shown in the image? Very good. The snake shown in the image is great. Okay. White and black bands अगर दिखते हैं तुम्हें, सफेद और काले bands दिखते हैं, that is usually a crate. And crate and cobra both belong to which family? Neurotoxic snakes. Neurotoxic snake are known as Elapidae family. Right? There are three snake families. I hope all of you are quite aware. Again, snapshot from FMG snaps. जिसने images अभी तक देखना शुरू नहीं किया, make a habit of every day 30 minutes of images from FMG snaps. 3 PDF है और ऑफ्था की चौथी chanting है. ठीक है? Everything is found over there. So there are three families of snake. First is the Elapidae family usually. Okay, these are neurotoxic. Two snakes in the Elapidae family. First is common cobra and second is crate usually. ठीक है? Common cobra is also known as naja and crate is known as Mangarus cerilius. ये एक बार क्वेश्चन पूछा जा चुका है, इसलिए बता रहा हूँ. Next is the Viperidae family. Viperidae family is hemotoxic, also known as vasculotoxic. Here we all have vipers. That is the Russell viper and the saw-scaled viper. Even we can have the pit viper, but यही दो इंडिया में, Russell viper and the saw-scaled viper. And the last one is the Hydropidae family. नाम से पता चल रहा है, hydro, that means they live in the sea or water. So usually these are sea snakes and they are myotoxic. So usually the cause of death in the Elapidae or the neurotoxic family is now neurotoxic. Now that means it will cause muscle paralysis. पूरी muscle, हर जगह में muscle paralysis हो जाएगा patient में. Okay, and mainly the patient will die due to respiratory muscle paralysis. Patient dies due to respiratory muscle paralysis. ठीक है? Whereas in Viperidae family, the cause of death is usually what happens in Viperidae. Why they are called as hemotoxic? Because hundreds and thousands of clots are formed in their circulation, which will go and block a lot of organs and that will cause death. And this condition is known as DIC. So the cause of death in Viperidae family is disseminated intravascular coagulation or coagulopathy. Last is the Hydropidae family. Myotoxic Q because the sea snakes are known to cause damage to the muscle. So they will cause rhabdomyolysis. Rhabdomyolysis is nothing but muscle breakdown. And when there is rhabdomyolysis, there is release of myoglobin. That myoglobin will go to kidneys and it will cause myoglobinuria. But myoglobin is a large protein. If it is excreting out through kidneys, it will cause acute renal failure. So the cause of death in hydropidae family is acute renal failure. So jaldi se cause of death in elapidae or neurotoxic family, respiratory muscle paralysis. Cause of death in viperidae or hemotoxic family, DIC. And cause of death in hydropidae or myotoxic family, acute renal failure. कोई दिक्कत नहीं है. So definitely, as it is a neurotoxic snake, the cause of death should be respiratory paralysis. आगे बढ़ते, question number 20. All of the following are principles of primary healthcare except. तो important is primary healthcare के चार pillars या चार principles होते हैं. This is a commonly repeated question thrice asked from PSM in your examination, and these are remembered by the mnemonic I, ACE. तो I से क्या याद रखना होता है? Intersectoral coordination. That means, for example, if you want to run your primary healthcare properly, definitely there should be coordination between health ministry, financial ministry, right? Planning commission, everything. So that is intersectoral coordination. Next is A stands for appropriate technology. That means if you want to manage a case of diarrhea, you should use ORS for the patient. That is an example of appropriate technology. Next, C goes for community participation. That is usually ASHA worker, for example. She is a resident of a village, but we have made her a part of the healthcare system. That is the best example of community participation. And E stands for equal या equitable. So it is not equal equitable. और जो बोल रहे हैं कि सर equal और equitable तो एक ही होता है, वो एग्जामिनर से जाके लड़ लेना, because English does not say this. Equal का मतलब समझ लो. Equal का मतलब तुम्हारे देश के हर एक बंदे को equal health care मिल रहा है. That means अंबानी को भी वही health care मिलेगा, सबसे गरीब आदमी को भी वही health care मिलेगा. That is what is a equal distribution. Equitable का मतलब क्या है? जिनके पास है उनसे लो, जिनके पास नहीं है उनको दो, and bring them all at the same level. That is what is called as equitable. ठीक है? तो equitable is give to the poor and bring them or uplift them to the same level. That is the basic thing that is known as equitable. समझ गए? तो equal मतलब सबको समान, but equitable मतलब those who don't have it, focus on them. ठीक है? So that is equitable distribution. ठीक है? So answer should be option number D. That is not equal, but rather equitable distribution. And what are the 4 A's, anybody? 4 A's of primary healthcare given in which conference? Given in which conference? Alma-Ata Conference of 1978. And what are those 4 A's? First is accessibility. That means the primary healthcare should be accessible to each and everyone in the society. Second, it should be available to each and everyone in the community. Next, it should be affordable to the rich as well as the poor in the community or your country. And last one is acceptability, because according to their customs and tradition, it should not contradict that. Otherwise, they will not accept the primary healthcare. Like your tribal people, if you're going against their traditions, they will not take the healthcare from you. Okay, so that's basic. So it should be acceptable to the people living in that particular area. So what are the 4 A's of primary healthcare? First is accessibility. Second is availability. Third is affordability. And fourth is acceptability. Next is question number 21. A healthy person gets in contact with an infected case. Okay, and they have to separate him not more than the incubation period of the disease. This is called as. So definitely if you're separating the healthy person who was in contact with the case, okay, so that is what is the quarantine. And quarantine is usually done for a maximum incubation period of that disease. COVID के लिए maximum incubation period was 14 days. So COVID के लिए quarantine period was 14 days. ठीक है? So that's the reason. And whereas if we are separating the patient or the case of a disease, very good. If you are separating the patient or a case of a disease, that is called as isolation. And कब तक separate करना होता है isolation में? So till the patient is negative. You can call it maximum period of infectivity, or the best answer will be till the patient is negative. Okay, so that's the important thing. No issues with this, anybody? Please remember. So if we are separating the healthy contact, answer is quarantine. If you are separating the patient or a case, answer is isolation. Quarantine is done for maximum incubation period of a disease. whereas isolation is done until the patient is negative. कोई दिक्कत नहीं है. What is generation time? The time gap or the time interval from entry of organism in the body till, तो incubation period क्या है फिर? Till maximum infectivity. Please remember, entry of organism in the body till maximum infectivity is known as which time? Generation time. Serial interval is what? The time period or the time gap between. Very good. The time period or the time gap between the primary and the secondary case. It is known as serial interval. And lastly, what is the incubation period then? Very good. So please remember the time period or the time gap between entry of organism in the body till the first sign or symptom in the patient. That is what is called as incubation period. So jaldi say important. The time gap from entry of organism in the body till first sign or symptom is known as incubation period. The time gap between entry of organism till maximum infectivity will be called as generation time. And the time gap between primary and secondary case of a disease is known as serial interval. तीनों definitions are very, very, very important. ठीक है? So that's important. Chalo. That's good definitions because they have been asked in your examination some or the other time. That's sure. Question number 22. A medical officer examines workers in bauxite mines. Okay. Agar definitely if they are giving you history of some industry or some occupation, they are likely talking about some occupational disease. Okay. A patient complains of breathlessness and chest pain. Chest X-ray has been given below. Which among the following is correct statement among the following? What is your provisional diagnosis by? Very good. The provisional diagnosis in this condition is nothing else but silicosis. I hope all of you are quite aware that silicosis is the most common occupational lung disease, and occupational lung diseases are also called as pneumoconiosis. So most common occupational lung disease or pneumoconiosis, answer is silicosis. Most common pneumoconiosis causing death, silicosis again. Okay, most common pneumoconiosis causing death is again silicosis. Chest X-ray, usually silicosis is seen in which industry workers? So usually it is seen in bauxite. Anthracosis किसमें दिखता है? So it is usually seen in bauxite miners. Second most important, it is seen in glass industry workers, and third important, cement industry workers. Very good. ठीक है? So three important professions you need to remember for silicosis. First is glass industry worker. Second is cement industry worker, and third is bauxite miners. These are at a highest risk of developing silicosis. ठीक है? Now important is, याद रख लो, in silicosis chest X-ray shows what? What are these? Very good. Bilateral reticulonodular opacity is called as the classical snowstorm appearance. So there will be a classical snowstorm appearance which will be seen usually. Okay, no issues with this. Along with that, what is this? Which type of calcification is seen? Very good. This is known as the eggshell calcification. So yaad rakhna, two X-ray findings in a case of silicosis. Which kind of appearance? Snowstorm appearance. And which kind of calcification? Eggshell calcification. कोई दिक्कत नहीं है इसमें. That's important. If they ask you guys कि the only pneumoconiosis which involves the lower lobes, because all other pneumoconiosis involves the upper lobes of the lung. The only pneumoconiosis involving the lower lobes. Answer is asbestosis. Very good. Asbestosis is due to asbestos exposure, and it is seen in which industry worker? Ship industry worker. Very good. It is usually seen in ship industry worker. Along with that, in which workers? Construction workers as well. Okay, it is also seen in construction workers also. And what is the characteristic X-ray finding in asbestosis? Anybody? X-ray. Very good. So in asbestosis, the characteristic X-ray finding is known as ground glass appearance. तो ये keywords होते हैं तुम्हारे एग्जाम में. जैसे ही वो snowstorm बोलेंगे, silicosis के बारे में सोचो. जैसे ही ground glass बोलेंगे, think about asbestosis. And in asbestosis, which kind of bodies will be seen? Asbestos bodies, also known as ferruginous bodies, will be usually seen. No issues with this. Important. Asbestosis is most commonly associated with cancer. The most common cancer associated with asbestosis. Shabash. Most common cancer associated with asbestosis should be adenocarcinoma of lung bachcho. But when the question is most specific or the most characteristic cancer associated with asbestosis, then your answer should be a pleura-based tumor known as mesothelioma. कोई दिक्कत नहीं है दोनों में, दोनों क्वेश्चन अलग है. मोस्ट कॉमन इज अडीनोकार्सिनोमा लंग, मोस्ट स्पेसिफिक इज डेफिनेटली mesothelioma. Whereas most common disease associated with silicosis, answer is TB, tuberculosis. Let's now talk about it. Option A says it is reversible once we remove the cause. No. Occupational lung diseases or any kind of pneumoconiosis causes fibrosis in the lung. And एक बार अगर fibrosis हो जाएगा, तो will it be reversed? No. So fibrosis cannot be reversed. So it is irreversible. Option B says it takes 6 to 10 years to develop. No. Minimum it takes 20 to 40 years to develop. Yes, 20 to 40 years of exposure is required for silicosis to develop. ठीक है? So this is wrong statement. Option C says fibrotic changes in the lungs of the patient can be reversed. We have already discussed that fibrosis cannot be reversed. Therefore, pneumoconiosis are irreversible. So best answer should be TB. Screening should be done at regular intervals. Why? Because TB is the most common disease associated with silicosis. ठीक है? So this was the previous year question. दो बार आ चुका है एग्जाम में. Don't make a mistake if it repeats again. ठीक है? Question number 23 now. A patient has pain while chewing and speaking and unilateral headache with retroorbital pain. आंखों के पीछे भी दर्द हो रहा है. Which of the following drugs should be given for treatment? पहले provisional diagnosis. Very good. It is a case of trigeminal neuralgia. Now what is algia, guys? Algia means pain. Neuralgia means pain due to a nerve irritation. And which nerve is irritated? Trigeminal nerve. Trigeminal nerve gives innervation in this region, na? Usually the temporoparietal region and the ophthalmic, maxillary and the mandibular region usually. So if trigeminal nerve is irritated, we will have pain all over here. We will have a unilateral headache in the temporal region or parietal region. Along with that, we will have retroorbital pain, which is very characteristic of trigeminal neuralgia and most important, as it involves the maxillary and mandibular division. Therefore, whenever we will open the mouth, close the mouth, matlab whenever you are trying to speak anything, whenever you are trying to chew anything, in that condition, you will have a lot of excruciating pain. Okay, बहुत severe गंदा दर्द होता है. That is what is the case of trigeminal neuralgia. What is the drug of choice? Very easy. The drug of choice should be carbamazepine. Okay, for trigeminal neuralgia. Can anybody tell me, usually in cases of neuropathic pain, what should be the drug of choice? Neuropathic, huh? Very good. So in cases of neuropathic pain, the drug of choice should be gabapentin, GABA analogs. Or second drug is pregabalin. So in cases of neuropathic pain, the drug of choice should be gabapentin or pregabalin. Neuropathic pain occurs in two conditions. Jaldi se. Diabetic neuropathy. It occurs in diabetic neuropathy. And second, shabash. It occurs in post-herpetic neuralgia. It occurs in post-herpetic neuralgia. Okay? So please remember, neuropathic pain is different. It occurs in two conditions. One is called as diabetic neuropathy and second is called as post-herpetic neuralgia. Drug of choice for them is GABA analogs like gabapentin or pregabalin. Carbamazepine is also the drug of choice for bachcho. Which kind of seizures? Very good. So drug of choice for focal seizures. But focal seizures in elderly, the drug of choice should be? Very good. So drug of choice for focal seizures, overall answer is carbamazepine. But drug of choice for focal seizures in elderly, then your answer changes to, lamotrigine definitely. Important is lamotrigine is commonly associated with a side effect and that is called as SJS, that is Steven-Johnson syndrome, when less than 10% of the body surface area is having peeling of skin. That is called as Steven-Johnson syndrome. It is commonly associated with lamotrigine. No issues with this, anybody? That's important. Phenobarbital is the drug of choice for? One naam hai na? So it is drug of choice for which seizures? Subtle seizures. And subtle seizures are the most common type of seizure in which age group, guys? Neonates. Okay, newborns. The most common type of neonatal seizure, answer is subtle seizures. And the drug of choice for subtle seizure, answer is phenobarbital. याद कैसे रखना है? One है ना? So first month of life is neonate. ठीक है? No issues with this, anybody? Which is the safest anti-epileptic drug in pregnancy? Levetiracetam, followed by lamotrigine. Please remember this. No issues with this, anybody? So remember, these are the most important things for you. Now, question number 24. For the treatment of acute migraine attack, a patient took some medicines. After that, she develops change in color vision and there is numbness in the tip of the thumb as well. What is the likely drug responsible and its treatment also? So, jaldi se batao, what is the drug of choice for migraine and gout? Favorite, hotshot favorite of pharma. रुको तो सही. What is the drug of choice for acute migraine? अब बताओ. So drug of choice for acute migraine are NSAIDs, non-steroidal anti-inflammatory drugs. Drugs like naproxen, paracetamol, ibuprofen, indomethacin, all of these. ठीक है? But they say drug of choice for acute severe migraine. For acute severe migraine, the drug of choice should be triptans. Triptans act on which receptors, guys? 5-HT, 1B, 1D. Agonist या antagonist? Agonist. So triptans are nothing but 5-HT1B, 1D agonist, and they will cause vasoconstriction, and therefore the pain of the migraine will be relieved. Okay, so they are the drug of choice for acute severe migraine. Important is, what is the drug of choice for prevention of migraine? Very good. It is a non-selective beta blocker like propranolol. So drug of choice for prevention of migraine should be propranolol. Now, in cases of acute severe migraine, apart from triptans, the patient can also take one another drug which has the same mechanism, and that is called as ergotamine. But problem is, these ergotamines which are there, they are known to cause severe vasoconstriction. बहुत ज़्यादा severe vasoconstriction करते हैं, and as they cause severe vasoconstriction in the fingers, what will happen? Blood supply to the tip of the fingers will be decreased, and due to this ischemia, the patient will develop gangrene. So the side effect which is associated with ergotamines that you need to remember for sure is gangrene. Now the patient is only developing numbness, but further it will also develop color changes, skin ulcerations, finally cell death causing gangrene. Okay? So there will be severe vasoconstriction. And what should be the drug of choice for vasodilatation? It should be sodium nitroprusside. Because we know in cases of hypertensive emergencies or crisis, the fastest acting drug which is used, it is sodium nitroprusside. So answer should be option D for this. ठीक है, कोई दिक्कत नहीं है. In NEET PG as well as August 2020 एग्जाम दोनों का क्वेश्चन रह चुका है. ठीक है. Question number 25 now. It says a 5-month-old child was brought to you at a PHC with complaints of fever, cough, not able to feed, and breathing difficulty as well. On examination, respiratory rate was 58 breaths per minute. Along with that, chest retractions were present. What will be your next step of management? Now, at a level of PHC, if you are a medical officer, you need to manage a child of pneumonia, diarrhea, measles, malnutrition, or malaria. With the help of which guidelines? IMNCI guidelines. What are IMNCI? Integrated Management of Neonatal and Childhood Illnesses. According to this, the children which are there, they are usually under 5 years of age. एक group होता है 0 to 2 months and second group is 2 months to 5 years. And IMNCI guidelines are available for mainly 5 diseases, and these are remembered as D, M, P. D for diarrhea and dehydration. M for malaria, measles, malnutrition, and P for pneumonia. ठीक है, so we are talking about pneumonia. Important है, सबसे पहले क्या करना होता है? You need to assess the condition of the child. Once you have assessed the condition of the child, classify the illness of the child according to these 3 given categories: green, yellow, and pink category. Once you have classified the illness, then identify the treatment कि देना क्या है बच्चे को. Once you have identified the treatment, then give the treatment to the child. Ask the mother for follow-up, and you should advise the mother when to return immediately. ठीक है? So usually in cases of pneumonia, there are 3 categories: the green, yellow, and pink category. In green category, that means the child is having no pneumonia. The child is only having cough and cold. So if the child is not even having fast breathing, that is tachypnea, the child is not even having chest retraction or any other features of pneumonia, only there is cough and cold along with fever, then the child will be classified in which category? Green category. Okay, that is no pneumonia. क्या करना है इस बच्चे में? बस usually we need to soothe the throat of the child. That means we need to give cough syrup to the child. That's it. Okay? And we need to advise the mother when to return to us immediately. And important follow-up should be carried out in how many days? 5 days. Okay, no antibiotics should be started. याद रखना है बात. ठीक है? Next is the yellow category. That is the category of pneumonia. We categorize the child into yellow category if the child is having fast breathing. Okay, जल्दी से बताओ अभी. If the child is from 0 to 2 months, when we will call fast breathing or tachypnea, respiratory rate more than 60 breaths per minute. From 2 months to 1 year, more than 50 breaths per minute. And 1 year till 5 year, more than 40 breaths per minute. ठीक है? तो 0 to 2 months, more than 60. 2 months to 1 year, more than 50. And 1 year to 5 year, more than 40. ठीक है? So definitely that is fast breathing or tachypnea. Important is chest indrawing can also be classified into pneumonia. Yes, because chest indrawing is a common feature associated with pneumonia. It can be seen in a lot of children with pneumonia also. Okay, so just based on chest indrawing, don't classify the child directly into the pink category. There should be enough other signs to classify the child into the pink category. Okay, agar if the child is having pneumonia, that is yellow category, we need to start antibiotics. Which is the safest antibiotics for the child? Amoxicillin, and the antibiotic course should be given for a span of 5 days. Okay, and follow-up should be done in 2 days usually. Last is if the child is having any general danger sign. What is any general danger sign? If the child is unable to feed, if the child is having consistent vomiting, if the child is having seizures or convulsions, if the child is unconscious or the child is sust pada hua hai bachcha, that is lethargic. ठीक है? These are the general danger signs. So any one of the general danger signs, if they are there, ठीक है? So that is definitely an indication to classify the child into which category? Pink category, that is severe pneumonia. ठीक है? Or very severe disease you can call it. Apart from that, chest indrawing, an important stridor in a calm child. Because stridor क्यों होता है? Due to upper airway obstruction. And upper airway obstruction in a case of pneumonia is due to laryngeal edema. And if there is laryngeal edema, that means the child can have laryngospasm. And the child will go into respiratory arrest and निकल लेगा बच्चा. ठीक है? So that's the important thing. If the child is having stridor, that is an indication of admission for sure. ठीक है? So please remember that. Along with that, respiratory distress. Definitely, if the child is having respiratory distress, he cannot be managed with antibiotics only. That's very clear. ठीक है? So that's important. तो पिंक कैटेगरी में कब क्लासिफाई करोगे? If there is any one of the general danger sign, or the child is having respiratory distress, or the child is having stridor. ठीक है? What should be done? We should give the first dose of injectable antibiotics. Okay? Usually we don't even give chloramphenicol. We give other injectable antibiotics and we refer the child urgently to a higher center or to a hospital. ठीक है? चलो. Coming back to our question. हाँ? अभी नहीं है. क्लासिफाई पहले किया जाता था. नाउ दे हैव कंबाइंड द कैटेगरी टुगेदर ऑफ सीवियर निमोनिया एंड वेरी सीवियर डिसीज बोला उन्होंने. ठीक है? तो सीवियर वेरी सीवियर निमोनिया पहले आता था, अब नहीं है वो कैटेगरी. सो 5 month old child. ओके, तो 5 month old है. दैट मींस रेस्पिरेटरी रेट कब टैकिपनिया बोला जाएगा? व्हेन द ब्रेथ इज मोर देन 50 breaths per minute. Is the child having? Yes, 58 hai. So the child is having tachypnea. Along with that, the child is having fever. Along with that, the child is having cough. But important is the child is having inability to feed. The child is having breathing difficulty. Okay, so the child has to be classified into severe pneumonia. Or which category color? Pink category. And what should be the treatment for severe pneumonia or pink category patients? Okay, so we need to give amoxicillin, okay, and refer the child immediately to a higher center. कोई दिक्कत नहीं है? चलो. Question number 26 now. Easy question, previous year. An elderly chronic alcoholic patient has presented to the OPD today. The following findings were noted in the patient. What are the findings? First is gum bleeding, and second is small bleeding spots known as petechiae. दोनों अभी देखे हमने. किसमें दिखते हैं बच्चों? Vitamin C deficiency, that is also known as scurvy, and vitamin C is also known as ascorbic acid. तो किसकी लेवल देखोगे प्लाज्मा में? Ascorbate या ascorbic acid की लेवल. So deficiency or decreased plasma ascorbate levels will tell you that the patient is suffering from ascorbate or ascorbic acid deficiency or not. Important is RBC transketolase activity. Important question है ये. RBC ये recent नीट पीजी एग्जामिनेशन का क्वेश्चन है. RBC transketolase activity will tell you about the levels of which vitamin in the body. Very good. It will tell you about the vitamin B1 levels, that is thiamine. Whereas vitamin B2, also known as riboflavin, उसकी levels के बारे में कौन से एंजाइम की एक्टिविटी बताएगी? It is RBC glutathione reductase. Please remember only these two. ठीक है? तो याद रखना, because these two enzymes require these two vitamins for their action. तो अगर ये विटामिन नहीं है तो ये एंजाइम्स काम करेगी क्या? नहीं. तो इनकी एक्टिविटी क्या हो जाएगी? कम. So that is how you will get to know about them. So please remember, vitamin B1 or thiamine deficiency assessment can be done with the help of RBC transketolase activity, whereas vitamin B2 or riboflavin levels can be assessed with the help of RBC glutathione reductase activity. कोई दिक्कत नहीं है इसमें. That's the important thing you need to remember, guys. ठीक है? In cases of scurvy, I have told you gum bleeding, petechiae, pseudo paralysis. Usually, along with that, there will be painful swelling of the costochondral joints or costochondral junction, and that is called as scorbutic rosary. Rickets में क्या होता है? Rachitic rosary. But ricket वाला painful होता है, painless होता है? Painless. But in scurvy, it is very, very painful. Please remember that. Along with that, X-ray findings important from orthopedics. Please remember, there will be classical sub-periosteal hemorrhages. Okay, as you can see, between the bone and the periosteum, there is a hemorrhage. Next, there is a classical scorbutic zone known as the Trummer-Felt zone. Then there is a dense zone of calcification known as which line? White line of Frenkel, usually. This line, the white line of Frenkel. Then there is a ring-like epiphysis known as which sign? Wimberger sign. Very characteristic. Okay. Ring-like epiphysis known as which sign? Wimberger sign. And this extra growth over here is known as which spur? Pelton's spur. तो जल्दी से एक्सरे फाइंडिंग्स इंपॉर्टेंट है. क्या दिखता है? कौन से टाइप के हेमोरेज? सब पेरियोस्टियल हेमोरेज. The scorbutic zone at the epiphysis is known as Trummer-Felt's zone. The dense zone of provisional calcification is known as which line? White line of Frenkel. Then the ring-like epiphysis is known as Wimberger sign. And this overgrowth is known as Pelton's spur. कोई दिक्कत नहीं है इसमें. याद रखना, chronic alcoholic patient. A lot of people might have thought कि vitamin B1. जरूरी नहीं है. Important, chronic alcoholic patient is having deficiency of multiple vitamins and multiple minerals in the body. Yes, he does. Okay. So please remember, chronic alcoholic patient agar mention karte, he can have multiple mineral and multiple vitamin deficiencies that you need to be aware of. Question number 27 now. A 35-year-old patient from Bihar comes with generalized bone pain and below given finding. He was diagnosed to have fluorosis. What is the likely change to be noticed in his bones? So what is the diagnosis? They have already given it as fluorosis. What is the change which is seen in the teeth? This is a case of dental fluorosis. Usually, fluorine is a double-edged word. कमी भी अच्छी नहीं है और ज़्यादा भी अच्छा नहीं होता है. So what is the optimum or normal level of fluorine? What is the most common source of fluorine? Drinking water. What is the normal level of fluorine in drinking water should be? 0.5 to 0.8 ppm parts per mole or milligrams per liter. That's one and the same thing. ठीक है? तो ये क्वेश्चन आ चुका है. 0.5 to 0.8 ppm. If it goes below 0.5 ppm, then it causes dental caries. That is nothing else but dental infection. But when it goes more than 1.5, then it causes dental fluorosis. Fluorosis ना तो excess. ठीक है? Osis. So please remember, more than 1.5 that causes dental fluorosis. 3 to 6 ppm will cause Shabash, skeletal fluorosis. That is, bony changes will be seen. And at more than 10 ppm, it will cause crippling fluorosis. What do I mean by crippling fluorosis? The patient cannot walk any further. The patient will crawl. Okay, chal hi nahi payega patient. No issues with this. So fluorine less than 0.5 causes dental caries. Fluorine more than 1.5 causes dental fluorosis. 3 to 6 ppm causes skeletal fluorosis. And more than 10 causes crippling fluorosis. Important is the first changes noticed in teeth. Ye sabko pata hai. Question was which teeth? The first change to be noticed in cases of fluorosis is usually the upper central incisors. Okay, it is the central teeth, na? So it is the upper central incisors. The first change of fluorosis is noticed in the upper central incisors. What is this bony finding in cases of fluorosis? क्या दिख रहा है? Excess deposition of calcium inside the bone. Therefore, the bone appears more white, and that is nothing else but osteosclerosis. That is nothing else but osteosclerosis. So, answer to this question will be option number A. ठीक है? याद रखना. Now, important is for defluoridation. If there is excess amount of fluorine in drinking water, for defluoridation, what is the technique which is used? Shabash. For defluoridation of water, the technique used is known as the Nalgonda technique. What is the sequence of addition of substances in Nalgonda technique? Lab. That is, lime is added first, followed by alum, followed by bleaching powder. This has been questions, guys. So, in cases of fluorosis, the technique which is followed for defluoridation is known as Nalgonda technique given by Niri Nagpur, and the sequence in which we add the substances are lab. ये sequence पूछी जा चुकी है. Lime, alum, bleaching powder. ठीक है? No issues with this, anybody? To remember this about fluorine, that's very important. Okay? Question number 28 now. A woman tried to fake the pregnancy and delivery as well. After some time, she brought the neighbor's child, claiming it to be her child, and trying to blackmail him for getting benefit in property. This will be called as. It is called as option B, that is supposititious child. Supposititious child is nothing but a fake child, or sometimes in the option they might write it as a fabricated child. Fabricated matlab banaya hua bachcha. Okay, who's not born to her, but she has brought the child somewhere. She's claiming कि ये उसी का बच्चा है. ठीक है? So that is supposititious child or a fabricated child. Important is, what is a posthumous child? Anybody? Child who is born after death of father or mother. So very good. After death of father, if a child is born, that is what is called as a posthumous child usually. No issues with this, anybody? Then, if two ovaries are fertilized in the same cycle, acts of coitus, that is called as. So, if two ovaries are fertilized, please remember, if two ovaries are fertilized in same cycle, with same act of coitus or different act of coitus? Different act of coitus. That is a case of superfecundation. That is known as superfecundation. What is superfetation on the other hand? Superfetation is also when the two ovaries are fertilized, but in the same cycle or different cycle, buddy? In the different cycle, and obviously with different acts of coitus. ठीक है? तो याद रख लो, अगर दो ओवास fertilize हो रहे हैं same cycle में with two different acts of sex or coitus, that is known as superfecundation. If two ovaries are getting fertilized in two different cycle, one in first month, next in second month usually. ठीक है? With definitely two different acts of sex or coitus, that is what is called as superfetation. In humans, can we have superfetation? No. Basic reason is because as soon as you get pregnant for the first time, you immediately start having amenorrhea. अगली साइकिल होगी क्या? नहीं होगी. तो अगली साइकिल होगी नहीं, तो दूसरा बच्चा डिफरेंट साइकिल में होगा क्या? तो in humans we and only see superfecundation. Superfetation is a phenomena which is seen in animals, not in humans. ठीक है? Munchausen syndrome क्या होता है, anybody? Faking medical symptoms, medical attention. Okay, patient जानबूझ के कुछ ना कुछ symptoms develop कर रही है, so that she gets admitted in the hospital and she gets a attention usually. This is done by people who are in the healthcare industry, nurses or doctors usually. ठीक है? So that is called as Munchausen syndrome. Important is this, अगर mother अपने बच्चे के लिए कर रही है, mother symptoms in the child, and definitely the child has been admitted a lot of number of times, that is called as Munchausen syndrome by proxy. तो अगर खुद के लिए करो तो Munchausen syndrome, बच्चे के लिए करो तो Munchausen syndrome by proxy. That is seeking symptoms to get medical attention. That is what is Munchausen. So the question number 29, easiest one. 83-year-old female was autopsied after her death. She had long-standing valvular disease and with cardiac atrophy. Cardiac atrophy Why? Definitely due to aging. कितनी उम्र है उसकी? 83 ना. So definitely there is stain, that is hematoxylin and eosine stain, perinuclear. Around the nucleus, brown color deposits with image. ठीक है? So usually it is due to which pigment deposition? It is due to lipofuscin. Lipofuscin is also known as lipofuscin को lipofuscin ही बोलेंगे क्या? Lipochrome, also known as which pigment? Anybody? Wear and tear pigment. Lipofuscin or lipochrome or this wear and tear pigment will deposit with increasing age of the patient. So lipochrome deposition is suggestive of aging. Lipochrome deposition in the cell is suggestive of aging. And it is which color pigment? Brown colored pigment. It deposits around the nucleus, that is perinuclear arrangement होता है. No issues with this anybody? So अगर कभी भी बुढ़ा patient आता है, heart biopsy, any biopsy, if they say and they say brown color deposits, you need to think in terms of lipofuscin or lipochrome. It's easiest one. ठीक है? What is the stain used for copper? Anybody? Very good. It is the rhodamine stain. Okay. So copper staining कब करनी पड़ेगी? Wilson's disease, right? So usually the stain used for copper is known as rhodamine stain. The stain used for hemosiderin. Hemosiderin is pigment. Anybody? Iron pigment. Okay. So very good. The stain used for hemosiderin is known as Prussian blue. Hemosiderin is also a brown colored pigment. Hemosiderin is also a brown colored pigment because it is an iron pigment. How to differentiate? That's why we use the Prussian blue stain, because after using a Prussian blue stain, what happens? The hemosiderin or the iron changes its colors to blue, and this is done by a reaction known as Pearl's reaction. Very good. When there is excess of hemosiderin in the body, this excess of hemosiderin will get deposited in various tissues, and that condition will be called as hemosiderosis, also known as hemochromatosis. It will get deposited in the liver, causing hepatitis, and finally cirrhosis. Next, it will get deposited in the pancreas, damaging the beta cells of pancreas, causing insulin deficiency, leading to diabetes mellitus. Along with that, it will activate melanocytes of skin, causing bronze discoloration of skin. Therefore, hemosiderosis is characterized by bronze diabetes mellitus, because there is bronze discoloration of skin and there is insulin deficiency due to damage of pancreas, causing diabetes mellitus. No issues with this anybody? That's important. You need to remember that properly. ठीक है? याद रखना है अच्छे से. Melanin is a black colored endogenous pigment. That means which is formed in the body itself. And what is the stain used for melanin? Shabash. That was a previous year question again. It is Masson Fontana. So the stain used for melanin is known as Masson Fontana. Next is, what is this anybody? Light microscopy है, biopsy दिख रही है तुम्हें, kidney की biopsy है. What are this pink color structure? Chalo, I'll tell you the stain. The stain which is used over here is Congo red stain. And Congo red stain is used for amyloid. Very good. So this is nothing but amyloid deposition. The best stain used for amyloid is known as Congo red stain. And amyloidosis under polarized microscopy shows which kind of birefringence? Very good. It shows apple green birefringence. So under polarized microscopy, amyloid deposition shows apple green birefringence. Important is, please remember, most common organ involved in generalized amyloidosis. Most common organ involved in generalized amyloidosis. Kidneys. Very good. Okay, it is the kidneys which are the most common organ involved. Phagospleen, tardaceous spleen. ये previous year questions आ चुके हैं. These are examples of amyloidosis in spleen itself. ठीक है? What is this blue colored stain? Previously this was very good. Previously these were brown colored deposits. Now they have turned blue in color due to the Pearl's reaction. This is nothing but the Prussian blue stain, and this is a case of hemosiderosis. Next is, this is the calcium, and the stain which makes calcium black is known as von Cosa stain. Okay, so von Cosa stain is used for calcium, and it will stain calcium black in color. The stain which will stain calcium red in color is known as, it is known as Alzarin red stain. Please remember, calcium के लिए दो stain use होते हैं. The one which stains its black is known as von fossa stain. The one which stains it's red, it is known as azarine red stain. Calcium deposition or calcification can be of two types: in dead, dying, damaged, degenerated, and tumor tissues. It is dystrophic calcification. But in normal living tissues, it is metastatic calcification. Okay? So samoma bodies will be an example of dystrophic or metastatic calcification. Very good. Samoma bodies, as they are seen in tumor cells, therefore they are an example of dystrophic calcification. Okay? No issues with this, anybody? Please remember this. Next, these are the fat stains. The one which stains fat black, red is known as oil red O stain. So oil red O stain is used for fat, whereas the stain which will stain the flat black is known as Sudan black B stain. Okay, so please remember, fat ke liye there are two stains which can be used. The one which will stain the fat red is known as oil red O. The one which will stain the fat black is known as Sudan black B. तो ये कोई नहीं पूछने वाला कि फ्लैट ब्लैक स्टेन हो रहा है, क्योंकि नाम में है उसके. वो किसके लिए यूज होता है ये पूछा जाएगा. Which is the best stain for fat? So answer should be Sudan black B usually, followed by oil red. No issues till anybody? Chalo. Moving further. Question number 30. It says a patient after trauma was brought to the emergency room. Okay. On neurological examination, he was found to have normal handwriting skills and comprehension. What is comprehension? Understanding. मैं जो बोल रहा हूं वो तुम्हें समझ में आ रहा है शायद. तो वो क्यों है? Because your comprehension or understanding is intact. But the patient was unable to speak. He was not able to speak anything. Where could be the lesion for this clinical condition? So, important is there are two speech areas. One is the Broca's area and second is the Wernicke's area. Both of them are connected by fibers and these are called as arcuate fibers, also known as arcuate fasciculus. Okay? That's important. Now important is Broca's area is motor speech area or sensory speech area. So Broca's area is motor speech area, whereas Wernicke's area is sensory speech area. So what should be the function of Broca's area, guys? So it is responsible for fluency of speech. Whatever you are able to speak, तुम बात कर पा रहे हो, वो Broca's area की वजह से. Okay? What is the function of Wernicke's or sensory speech area? It is comprehension. That is what is your understanding. जो मैं बोल रहा हूँ वो समझ पा रहे हो because your Wernicke's area is intact. And what is the function of arcuate fasciculus? शाबाश, very good. It is naming and repetition. Okay, तुम्हें चीजों के नाम पता है या फिर you are able to repeat whatever I'm saying. That is because your arcuate fasciculus is intact. ठीक है? Now important is Broca's area is located in which lobe? Frontal lobe. It is located exactly in the inferior frontal gyrus. Whereas Wernicke's area is located in which lobe? Temporal lobe. It is located in the superior temporal gyrus. Area number for Broca's. It is 44 and 45. So area number 44 and area number 45 are the Broca's area or the motor speech area. Wernicke's area number. Area number 22, 39 and 40. Okay, so 22, 39 और 40. So please remember area number 22, 39 and 40 are Wernicke's speech area. No issues with this. Wernicke's speech area के साथ साथ कौन होता है? Auditory cortex. Area number for auditory cortex 22, 41, 42. Reason is जो तुम सुन रहे हो वो समझने का काम किसका है? Wernicke's का. सुनने का काम किसका है? Auditory cortex का. Auditory cortex सुनता है बट समझने का काम किसका है? Wernicke's का. इसीलिए दोनों साथ साथ काम करते हैं. Both of them are in the superior temporal gyrus for that reason and one area is common between both of them, that is area number 22. ठीक है? So that's the important thing. Now if there is damage to the Broca's area, will you be able to speak? No. Okay, definitely the fluency of the speech will be affected. So if there is Broca's area damage, you will suffer from which kind of aphasia? Aphasia, that means you are not able to speak. Fluent or affluent aphasia? Definitely you will suffer from affluent aphasia or you can call it motor aphasia. Okay, you can call it motor aphasia. Okay, here the patient is unable to speak. That means he is having damage to which region? Broca's area itself because the patient is not able to speak anything. Wernicke's area में अगर damage होगा then the patient will have fluent aphasia or affluent aphasia. फ्लुएंट अफीसिया, क्यों? क्योंकि पेशेंट बोले तो जा रहा है बट उसको कुछ समझ आ रहा है क्या? नहीं, वो उल्टा पुल्टा कुछ भी बोल रहा है, ही इज नॉट एबल टू अंडरस्टैंड व्हाट ही इज सेइंग, ठीक है? तो दैट इज अ फ्लुएंट अफीसिया. नेक्स्ट, इट कैन आल्सो बी कॉल्ड एज sensory aphasia because he is not able to understand or comprehend anything. Sensory aphasia. No issues with this? Okay. And if there is damage to the arcuate fasciculus, then the naming and repetition is affected. This kind of aphasia will be called as either conduction aphasia or anomic aphasia. क्यों? नेमिंग याद नहीं रहती है ना किसी चीज की. Therefore, arcuate fasciculus damage will cause conduction or anomic aphasia. ठीक है? So these are common questions. Motor cortex, guys. Primary motor cortex is area number 4, and somatosensory cortex or somatosensory area is area number 312 ना. Anatomy की इतनी वाट मत लगाओ रे. Question number 31, easiest one. Niti Aayog has replaced which authority? So we know Niti Aayog has replaced the Planning Commission, okay, from 2014. Important is Niti Aayog का full form पूछा गया है. It is, बोलो, National बोलो ना, शाबाश. It is National Institute for Transforming India. So please remember, Planning Commission क्या करता था काम? The same work Niti Aayog also does. It is a think tank of India. We have some brilliant minds sitting over there in the Niti Aayog usually, okay, who were there usually on the highest pedestals of Indian system. Usually the bureaucrats are there. Usually Amitabh Kant is the head, I feel so right now. So definitely, yeah, National Institute for Transforming India, they make the plans. ठीक है, गवर्नमेंट को क्या करना है, कैसे करना चाहिए, कैसे लॉन्च करना चाहिए, कोई भी स्कीम, कोई भी प्रोग्राम, they usually make a outline, they usually make a framework for it. ठीक है, therefore they are called as the think tank of India. ठीक है, तो प्लानिंग कमीशन था पहले, just the name has been changed, that is National Institute for Transforming India, that is Niti Aayog. No issues with this, anybody? So that's important. Question number 32, easiest. Which fertility indicator includes mortality? It is NRR. What is NRR? Net reproduction rate. Now net का मतलब ही बच्चों ये समझ लो ना कि नेट प्रॉफिट कितना है, फाइनल कितना है आउटपुट, राइट? नेट का मतलब टोटल नंबर ऑफ, रिप्रोडक्शन रेट मतलब टोटल नंबर ऑफ चिल्ड्रन या टोटल नंबर ऑफ गर्ल चिल्ड्रन who are only able to reproduce, only girl children. तो रिप्रोडक्शन रेट का मतलब ओनली टोटल नंबर ऑफ गर्ल चिल्ड्रन, बट नेट का मतलब टोटल नंबर ऑफ गर्ल चिल्ड्रन माइनस total number of girl children minus mortality, that is nothing else but deaths. That is, it is the total number of only alive girl children. So I'll tell you the formula. Definition. Net reproduction rate is the total number of girl children born to a female in her entire reproductive lifespan, including the mortality or taking the mortality or deaths into consideration. मतलब जितनी बच्चियां जिंदा है वो उसका नेट रिप्रोडक्शन रेट होता है. अगर मैं टोटल नंबर ऑफ गर्ल चिल्ड्रन बोलूं without subtracting the mortality, okay, that will be called as GRR, that is gross reproduction rate. It is the total number of girl children born to a female in her entire reproductive lifespan. That's it. Did I minus the mortality? No. तो अगर किसी फीमेल को 3 लड़कियां पैदा हुई है, उसमें से एक मर गई, तो उसका GRR कितना हुआ? 3. शाबाश. Okay, because in GRR or gross reproduction rate, I'll calculate the live as well as the dead girl children. But if I ask you what should be the NRR of this patient? 2, because alive girl children are only and only 2. So that should be her net reproduction rate. Okay, what is TFR, anybody? Total fertility rate. Total fertility rate is nothing but the total number of children, not only girl children. It is total number of children born to a female in her entire reproductive lifespan. Important is TFR can also be called as CFS, that is completed family size. It is also known as completed family size. कोई दिक्कत नहीं है इसमें. That's important. That is TFR और total fertility rate. यहाँ भी तुम डेथ सब्ट्रैक्ट नहीं करोगे, सब बच्चे गिनोगे, भले जिंदा हो भले मर गए हो. ठीक है, you will calculate everything. Crude birth rate is what? CBR is crude birth rate, number of births, number of the total births upon total mid-year population into 1000. अब मैंने ये बताया क्योंकि मुझे ये इसका आंसर चाहिए था. मिड ईयर पॉपुलेशन. It is calculated every year on 1st of July. That is National Doctors Day. ठीक है, तो important is this. Twice repeated exam question. Please remember that mid-year population every year is calculated on 1st of July. कोई दिक्कत नहीं है इसमें. Question number 33 now. Okay. If they ask you which is the best fertility indicator, anybody? Which is the best fertility indicator? Why best fertility indicator will be NRR? Because it is the only fertility indicator which takes mortality or deaths into consideration. बाकी किसी में deaths minus नहीं किए जाते. Next is question number 33. A child has been brought to the OPD with complaints of watery diarrhea, flatulence, that is gas बन गया है बच्चे के पेट में, vomiting, and parents give history of such episode multiple number of times. Child also has below given rashes on the lower limbs. Which among the following antibody will be seen on a serology? First of all, what are these kind of rashes called as? These are called as purpuric rashes. Bleeding spots जैसे दिख रहे हैं ना? So these are purpuric rashes. Purpuric rashes in a child, usually on the buttocks and the lower limbs. Very good. Sometimes even in along with abdominal pain and joint pain. That is suggestive of a small vessel vasculitis known as Henoch-Schönlein purpura. But Henoch-Schönlein purpura does not explain about the symptoms of malabsorption in this child. Okay, the child having watery diarrhea, flatulence, vomiting, okay, and this too multiple number of times. But Henoch-Schönlein purpura is which disease? Usually it is due to which antibody? So it is a IgA related disease, and we have discussed it a number of times that a lot of IgA related disease can occur together. One is a small vessel vasculitis known as Henoch-Schönlein purpura. Another is a malabsorption syndrome known as celiac sprue, also known as celiac disease. Third is a nephropathy known as IgA nephropathy, also known as which disease? Berger's disease. And last one, okay, it is usually a vesicular disease known as dermatitis herpetiformis, which causes itching and vesicles usually over the extensor aspect like elbows and the knees. Drug of choice for dermatitis herpetiformis, previous year question, dapsone. Drug of choice for dermatitis herpetiformis, answer is dapsone. कोई दिक्कत नहीं है इसमें, ठीक है? So definitely, what is the likely malabsorption syndrome in this child? Celiac sprue. Okay, and celiac sprue is an infective or an autoimmune condition, guys. Autoimmune condition. That means it is due to formation of antibodies, which will damage the duodenum of the patient. Okay. Usually these antibodies are two types. One is called as IgA. Both are IgA and subtypes, but anti-endomysial antibody, and second is anti-tissue transglutaminase antibody. ठीक है? So IgA anti-endomysial and ATTG antibody, usually tissue transglutaminase antibody, are the two important antibodies seen in cases of celiac sprue. Important question. They have even asked that celiac sprue is associated with which HLA? It is associated with HLA DQ2 and DQ8. Okay, please remember, celiac sprue is associated with HLA DQ2 and DQ8. Important. Now, in cases of celiac sprue, investigation of choice will be, it is a malabsorption syndrome. It only occurs after eating bro. Bro is what? Food containing gluten. So if the child eats any food containing gluten, as the child is having gluten sensitive enteropathy, the child will immediately develop features of malabsorption syndrome. ठीक है? B stands for barley. R stands for rye. Rice वाले सुनो, it is rye. ठीक है? तो rice दिया जा सकता है. ठीक है? It is rye. O for oats and W for wheat. These are gluten containing food. If the patient eats those, then the patient develops symptom. Investigation of choice. Investigation of choice is a colonoscopy plus biopsy. That is a duodenal biopsy. And what is seen on a duodenal biopsy? This is the normal biopsy, and this is celiac sprue. क्या दिख रहा है? Very good. The villi have been lost. There is loss of villi, or there is flattening of villi. ठीक है? No issues with this, anybody? That's the most important thing you need to remember over here. ठीक है? Another malabsorption syndrome, guys, माल absorption ही है, but it is infective in nature. And usually it is also associated with two extraintestinal symptoms like dementia and arthritis. What is the diagnosis? जैसे ये मेंशन करते हैं डिमेंशिया और आर्थराइटिस, इमीडिएटली डायग्नोसिस आ जाना चाहिए. शाबाश. It is a case of Whipple's disease, and Whipple's disease is due to a bacterial infection known as Trophirema Whippleyi. It is due to a bacterial infection known as Trophirema Whippleyi. Here also the most common site affected is the duodenum. Investigation of choice is again a duodenal biopsy. But on duodenal biopsy, what is usually seen? ये pink color के क्या दिख रहा है? Very good. These are pass positive macrophages. Now ये bacteria को खाने के लिए कौन आता है? Macrophage. So when these macrophages will eat the bacteria and we will use a pass stain, they will turn pass positive, that is pink in color. So these are pass positive macrophages. In which layer? In lamina propria. So pass positive macrophages in lamina propria is seen usually on the biopsy, duodenal biopsy in cases of Whipple's disease. No issues with this. Drug of choice will be third generation cephalosporins like ceftriaxone because it is a bacterial infection. ठीक है? But treatment for celiac sprue should be avoid ब्रो खाने ही मत दो बच्चे को तो होगा ही नहीं कोई दिक्कत. ठीक है? जल्दी से एंटी सीसीपी एंटीबॉडीज, एंटी साइक्लिक सिट्रुलिन पेप्टाइड एंटीबॉडी इज द इन्वेस्टिगेशन ऑफ चॉइस फॉर. शाबाश. It is the investigation of choice for rheumatoid arthritis. Please remember, what is the screening test for rheumatoid arthritis? RA factor. Rheumatoid arthritis factor is the screening test, but investigation of choice should be anti-CCP antibody. Rheumatoid arthritis, young patient or elderly patient? Young patients. Females or males? Females. Symmetrical, asymmetrical? Symmetrical. Unilateral, bilateral? Bilateral. Large joint, small joint? Small joints. Which joint is never affected? EIB. That is what is RA. Okay? So that's important. Next is anti-Saccharomyces cerevisiae antibody. ASCA antibody are seen in which condition? Crohn's disease. Okay, autoimmune condition known as Crohn's disease. Okay, it is seen in ASCA usually. P-ANCA antibodies are seen in ulcerative colitis. P-ANCA antibodies are seen in ulcerative colitis. Next important. Sorry. It is also seen in primary sclerosing cholangitis, which is commonly associated with ulcerative colitis. Na? Primary sclerosing cholangitis also we will see P-ANCA antibodies itself. कोई दिक्कत नहीं है. जल्दी से HLA-B27 is associated with. Giraffe is the mnemonic. J stands for juvenile rheumatoid arthritis. I stands for inflammatory bowel disease associated arthritis. Then R stands for rheumatoid. Sorry, R stands for reactive arthritis, previously known as Retter's syndrome. A stands for ankylosing spondylitis and P stands for psoriatic arthritis. ये HLA is important वाले बता रहा हूँ. HLA B5 और HLA B51. Very good. Behcet syndrome. That is painful genital ulcers and painful oral ulcers. ठीक है? Painful genital plus painful oral ulcers, that is known as Behcet syndrome. The HLA associated is HLA B5 and HLA B51. Question number 34. A patient was taking theophylline for bronchial asthma. After starting another drug, symptoms of theophylline toxicity started appearing. Which is the likely drug to cause theophylline toxicity? Important is, guys, now there are two kinds of drugs. One are called as enzyme inducers and the other called as enzyme inhibitors. Now, definitely, if we are already giving a drug to the patient and after that we will give enzyme inducer, what will happen? The enzymes will be activated, and as the enzymes are activated, the drug will be metabolized faster or slower? Faster. So as the drug is metabolized faster, it will be immediately kicked out of the body. So there will be drug failure or drug toxicity. So usually in cases of enzyme inducers, it will cause drug failure. Whereas if you are giving an enzyme inhibitor, now definitely the enzymes are inhibited. As the enzymes are inhibited, will the drug be metabolized now? No. It will stay in the body for a longer duration of time, and that will cause drug toxicity. So enzyme inhibitors are known to cause drug mnemonic. Jaldi se batao. Enzyme inducers can be remembered with the mnemonic GPRS cell phone. G stands for antifungal drug known as Griseopulvin. P stands for phenytoin. R stands for rifampicin. S stands for smoking. Cell stands for carbamazepine. Phone stands for phenobarbital. No issues with this, anybody? So these are the enzyme inducers. Enzyme inhibitors are remembered with the mnemonic. Vitamin K can't cause enzyme inhibition. Vitamin stands for valproate. K stands for ketoconazole. Can't stand for cimetidine. Okay, cause stand for ciprofloxacin. Okay, enzyme stands for erythromycin, and inhibition stands for isoniazid. Got it? कोई दिक्कत नहीं है यहाँ तक. तो important is this. ठीक है, तो at least ये mnemonic याद रख लो, तो it will be much easier. Now definitely they are saying toxicity. So the other drug is an enzyme inhibitor or enzyme inducer? Enzyme inhibitor. Therefore, the patient is developing drug toxicity. So now we have two drugs, valproate as well as erythromycin. Important is usually valproate has less chances of causing enzyme inhibition as compared to erythromycin. So here the best answer should be erythromycin itself. ठीक है, तो एक बेसिक याद देख लो, बहुत इजी लग रहा है कि most of the anti-epileptics are enzyme inducers except valproate. Most of the antibiotics are enzyme inhibitors except rifampicin. Okay, so that can be remembered. That will become much easier. Okay, so please remember that. Question number 35 now. A 65-year-old patient presented with dribbling of urine with urgency. He was azosin therapy. Okay, what would have been his diagnosis? Maybe PPH. Very good. Elderly patient having urinary symptoms. It is a case of benign prostatic hyperplasia. When the number of cells in prostate increase, therefore the size of prostate ultimately increases. And when the size of prostate increases, it will compress the prostatic urethra. So therefore, the urinary stream is decreased and the patient complains of lower urinary tract symptoms. He was started on prazosin therapy, but he started developing postural hypotension. What is postural hypotension? Whenever he stands from supine position, अचानक से उसका BP fall हो जाता है. Due to this sudden hypotension, he experiences dizziness. Which of the following is the better alternative drug for this patient? Now, in a case of BPH, usually, okay, the problem is what? That the prostate is compressing the prostatic urethra. We need what? Dilatation at the level of prostatic urethra. So the urine outflow will be better and the patient symptoms will be relieved. तुम बोलोगे sir, we can decrease the size of prostate. That can be done. But problem is, to decrease the size of prostate will give a drug. That will take 3 months to act. Can it be a drug of choice then? No. Drug of choice is the one which gives immediate relief. Okay? So usually for that reason, the one which gives immediate relief are the drugs which are known as alpha blockers. Now alpha blockers which are there, they act on alpha 1 blockers are act on alpha 1A as well as alpha 1B. Alpha 1A are located on prostatic urethra, smooth muscles of prostatic urethra, whereas alpha 1B receptors are located on smooth muscles of blood vessels. Now, if you are giving alpha 1 blockers, drugs like prazosin, terazosin, alfuzosin, these drugs will block alpha 1A as well as alpha 1B. As they are blocking alpha 1A, so the prostatic urethra is getting dilated. So urinary symptoms are definitely improving. But as alpha 1B receptors also block, therefore there is a vasodilatation that causes sudden drop in the blood pressure, and that leads to postural or orthostatic hypotension, which is an important side effect with prazosin like. That's the reason why we need to only block which receptor? Alpha 1A receptor. So the selective alpha 1A blockers which are there, these are drugs like tamsulosin, and the another drug from the same group is silodosin. Okay, so here the better alternative should have been tamsulosin or silodosin, which is considered to be the drug of choice for BPH. Okay, important. So here the answer should be option C, that is silodosin. Important is, yaad rakhna, sorry. Important is, prazosin causes orthostatic or postural hypotension. What is the drug of choice for that? Very good. It is Drin. Okay, so please remember orthostatic या postural hypotension के लिए the drug of choice you need to remember. Answer is midodrine. This was a previous year question as well. Midodrine is क्या होती है वो? Alpha 1 block कर रहे हो ना? Midodrine should be alpha 1 agonist. So midodrine is the alpha 1 agonist itself. Please remember this. ठीक है? The another alpha 1 agonist you need to remember, and that was a previous year question. Answer is phenylephrine. Phenylephrine is the only one drug which causes mydriasis. What is mydriasis? Dilatation of pupil without cycloplegia, without paralysis of your ciliary muscle. All other mydriatics cause cycloplegia also. So that was the previous year question. Only mydriatic without cycloplegia. Answer is phenylephrine. And phenylephrine is which group of drug? Alpha 1 agonist. No issues with this. Alpha 2 agonist important drugs हैं. बताओ जल्दी. Alpha 2 receptors are present on the presynaptic channel. They act as brakes on the sympathetic system itself. Therefore, they are known to decrease blood pressure. Very good. Alpha 2 agonists are drugs like clonidine. And second drug, alpha methyl dopa. Clonidine and alpha methyl dopa both are used due for hypertension in pregnancy. But drug of choice for hypertension in pregnancy, labetalol, which is the alpha plus beta blocker. In hypertension in pregnancy, drug of choice is labetalol. Oral or IV? Oral. Hypertensive emergency in pregnancy, drug of choice is again labetalol, but this time IV usually. But in one of the previous year questions, labetalol was not in the option. The second best answer should be alpha methyl dopa. If that is not an option, the third best answer should be hydralazine. Okay, hydralazine भी नहीं हो तो बाकी drug prazosin या clonidine तो you can mark as well. ठीक है? So that is the important thing. No issues with this, anybody? Okay, so that's important. Timolol is usually a topical beta blocker which is used for which condition? Glaucoma. Very good. Okay, but timolol is contraindicated in a patient of bronchial asthma. So now usually beta blockers, topical beta blockers in glaucoma should be contraindicated in a patient of bronchial asthma. But previous year question again, which among the following topical beta blocker can be used in a bronchial asthma patient? It is known as betaxolol. Why? Because it is a selective beta 1 blocker. It has no blocking action on beta 2 receptors which are present in the bronchus. Therefore, no bronchoconstriction, no respiratory distress. समझ गए? So please remember, the only beta blocker which can be given as a topical agent in cases of glaucoma answer can be betaxolol because it is a selective beta 1 blocker. कोई दिक्कत नहीं है इसमें? Understood? Terazocine क्यों नहीं हो सकता? Because it is from the same group as prazosin itself. कोई मतलब नहीं है. Prazosin will be the drug of choice for BPH, but in which condition? Very good. BPH plus hypertension. क्योंकि इसमें BP वैसे भी कम करना है अपने को. तो normally for drug of choice for BPH answer should be selective alpha 1A blockers, that is tamsulosin or silodosin. But if they say BPH with hypertension, then the drug of choice will be alpha 1 blockers like prazosin, terazosin, alfuzosin. ठीक है? Sure. And lastly, to decrease the size of prostate, normally prostate की size क्यों बढ़ती है? Due to action of dihydrotestosterone. Testosterone is converted to its active form known as dihydrotestosterone by an enzyme known as 5-alpha reductase. So we can give 5-alpha reductase inhibitors, drugs like finasteride. But finasteride takes a long time to act. It will help in decreasing size, but it will take a long time to act. Therefore, not a drug of choice. 55-year-old patient presented with difficulty in breathing and there was rashes after ingestion of seafood. He has shown similar reaction in the past following consumption of the same food items. Which of the following hypersensitivity reaction do you relate it with? So, एक तो ये या दूसरा बी स्टिंग. सरकारी क्वेश्चन है तुम्हारे एग्जाम. उनको दूसरी आती ही नहीं है, हाइपरसेंसिटिविटी शायद पता नहीं, वो एनाफिलैक्टिक की हर बार पूछते. तो आइदर आफ्टर बी स्टिंग दे से और आफ्टर ingestion of some food items. Usually when the patient is allergic to these food items, patient starts developing usually respiratory distress or difficulty in breathing along with some rashes on the skin. Okay, so it is a type of anaphylactic hypersensitivity, that is type 1 hypersensitivity. This is the mnemonic. Acid is the mnemonic. Type 1 hypersensitivity is anaphylactic. Which antibody mediated? IgE mediated. Type 2 hypersensitivity is cytotoxic, that is antibody mediated. Type 3 hypersensitivity is immune complex mediated. Okay, that is antigen antibody complex mediated. Type 4 hypersensitivity is delayed type of hypersensitivity, can also be called as T cell mediated hypersensitivity. Type 1 के लिए पूरे A याद रखते हैं. That is A for anaphylaxis or anaphylactic shock, A for allergies, A for asthma, A for atopy. That means any kind of atopy. That means what are the conditions associated with asthma or atopy? Atopic dermatitis in the patient, allergic rhinitis in the patient, hay fever in the patient, ठीक है, and lastly bronchial asthma. These are the 4 conditions which are atopic. एक patient में हो सकते हैं, एक family में हो सकते हैं जिनमें atopy है, ठीक है. Next is type 2. Type 2 के लिए the mnemonic is telegram. T stands for transfusion reactions, usually mismatched blood transfusion or ABO incompatibility. मैंने बताया था सर्जरी में टाइप 2 और टाइप 1 दोनों होता है, बट मोर इंपॉर्टेंट इज टाइप 2 बिकॉज एंटीबॉडीज आर फॉर्म्ड. ओके, सो ट्रांसफ्यूजन रिएक्शंस. देन G stands for good pasture syndrome, that is anti-glomerular basement membrane antibodies are formed. Very important क्लासिकल कीवर्ड है. एंटी-GBM जैसे ही दिखता है क्वेश्चन में आंसर कैन बी डायरेक्टली गुड पास्चर. ठीक है. नेक्स्ट इज G फॉर ग्रेव्स डिसीज ऑल्सो. रिसेंट नीट पीजी क्वेश्चन, कौन सी एंटीबॉडीज दिखती है? वेरी गुड, इट इज द LATs antibodies, that is long acting thyroid stimulating antibodies. Therefore Graves disease is the most common cause of hyperthyroidism or hypothyroidism. Hyperthyroidism. R stands for rheumatic fever or even rheumatic heart disease as well. A stands for autoimmune hemolytic anemias and M stands for myasthenia gravis. Two conditions जहां पे type 5 will be a better answer. Good pasture syndrome and myasthenia gravis are the two conditions where type 5 hypersensitivity should be answered first if that is an option. If not, answer it as type 2 itself because type 5 is nothing but a subtype of type 2. Type 3, the mnemonic is sharp. S stands for serum sickness. Second S stands for SLE. H stands for hypersensitivity pneumonitis. A stands for Arthus reaction. R stands for reactive arthritis, previously known as Retter's syndrome. Characteristic triad, conjunctivitis, urethritis, polyarthritis. कब बोलते हैं ना? Next, P stands for PSGN, post-streptococcal glomerulonephritis, and P also stands for PAN, polyarthritis nodosa. Most important, serum sickness, Arthus reaction. यही भूलते हैं सब लोग और इसी पे क्वेश्चन आता है इसीलिए. ठीक है. टाइप 4, द निमोनिक इज एमसीडी. एमसीडी वाले लोग ढीले होते हैं, बहुत धीरे धीरे काम करते हैं. डीएमसी याद रख लो, एमसीडी याद रख लो. एम स्टैंड्स फॉर मल्टीपल स्क्लेरोसिस. सेकंड एम स्टैंड्स फॉर Montauk's test. C stands for chronic graft rejection and D stands for dermatitis. But which dermatitis? Contact dermatitis. Important is अगर chronic graft rejection is type 4, hyperacute and acute graft rejection will be. Very good. So hyperacute and acute graft rejection will be type 2 hypersensitivity. ठीक है, याद रखना. Question number 37 now. Arthus reaction is usually due to a lot of antigens which are there. Patient will have a previous history of some viral infection, after which due to the antibodies which are formed against those antigens usually. Okay, so those antigen antibody complexes will go and it will cause dissemination throughout the body, and that will cause multiple manifestation. There will be involvement of multiple organs in the body along with some dermatological manifestation. That is a Arthus reaction. ठीक है. Question number 37. A child presented to the casualty with intense headache, vomiting episodes and neck stiffness. A lumbar puncture was performed. CSF analysis shows presence of neutrophils, elevated proteins and decreased glucose levels. The gram stain shows the following organism. What is the most likely causative agent? Important is, guys, intense headache, vomiting and neck stiffness, sometimes along with fever, is the classical triad of meningitis. So they are talking about a case of meningitis. Therefore, they have performed a lumbar puncture and CSF analysis shows neutrophils. I have told you there are 4 causes of meningitis: bacterial, viral, tubercular, fungal. Only which shows neutrophils? Very good. Only bacterial shows neutrophils. Rest all shows lymphocytes. Therefore, it is a case of bacterial meningitis. So any which ways I can rule out option C and D because it is herpes simplex virus and Cryptococcus neoformans, which is a fungus. Okay? Important is now elevated proteins are there, they are seen in every case. Decreased glucose levels because bacteria eats glucose, therefore the glucose levels decreases. what is seen on gram staining? Red color organism. So gram positive or gram negative? Gram negative. Cocci or bacilli? Cocci. So gram negative cocci. All cocci are gram positive except two. One is called as meningococcus. Second is called as gonococcus. Meningococcus is also known as Neisseria meningitidis, and gonococcus is also known as Neisseria gonorrhoeae. Okay? And we know that meningococcus is usually a diplococci. दो जोड़ी जोड़ी में रहते हैं. ठीक है? They are a gram negative diplococci which are usually seen. And meningococcus is a known cause of meningitis as well. So it is a case of meningococcal. Most common subtype A serovar. ठीक है? In meningococcal conjugate vaccine, which serovar is not present? Very good. It is the B serovar which is not present in the meningococcal conjugate vaccine. This was the previous year question. Which serovar of meningococcus is not present in meningococcal vaccine? Answer is B serovar. ठीक है? तो यहाँ पे what is the answer? Answer is option A, that is Neisseria meningitidis. Streptococcus pneumoniae, though it is the most common cause of, sorry, it is the most common cause of meningitis, not only in children but also in adults. Okay, but over here we are seeing diplococci. Streptococcus is a chain of cocci, guys. Okay, so that's the basic important. And Streptococcus pneumoniae is gram positive, not gram negative. Okay, so that's the reason why I can easily rule it out. Important is Streptococcus pneumoniae or pneumococcus. It is the most common cause of pneumonia. Which type of pneumonia? Community acquired pneumonia. Typical or atypical? Typical pneumonia. Round pneumonia, lobar pneumonia. सबकी most common cause is usually strep pneumonia itself. It shows which kind of colonies. क्या दिख रहा है? Trotsman or carom coin-like colonies. Previous year question. Trotsman-like or carom coin-like colonies are seen in. Answer is straight away Streptococcus pneumoniae, also known as pneumococcus. ठीक है? No issues with this. What is this? Which stain is this, anybody? Which only stains the capsule? Very good. It is a background stain known as India ink stain. And what is this organism? Cryptococcus neoformans. I hope all of you are quite aware. Cryptococcus neoformans is the most common cause of meningitis in which patient? In HIV positive patients. No issues with this. Important is question in August 2020. Which is the rapid method for diagnosis of cryptococcal meningitis? So it should not be India ink stain. बहुत लोगों ने immediately India ink stain मार दिया. Better is lateral flow assay for cryptococcal antigen. Better rapid test is a lateral flow assay for cryptococcal antigen. And investigation of choice will be ELISA. Investigation of choice will be ELISA. ठीक है? Better rapid test is lateral flow assay. Overall better is ELISA. कोई दिक्कत नहीं है इसमें. Don't make a mistake with it. ठीक है? याद रखना है बात. चलो. So that was important things. Strep pneumonia, yeah, sorry. Streptococcus, I hope all of you are quite aware. Group A Streptococcus is also known as Group A beta hemolytic Streptococci, also known as Streptococcus pyogenes. That is a known cause of scarlet fever. Which tongue? Strawberry tongue. Also seen in Kawasaki disease. It is also known cause of tonsillitis or pharyngitis. It is also known cause of PSGN, also IgA nephropathy. ठीक है? Please remember. Group B Streptococcus is known as Streptococcus agalacti. Okay, important is Streptococcus agalacti or Group B Streptococcus is the most common cause of neonatal meningitis as well as neonatal sepsis worldwide. ठीक है? Most common cause of neonatal sepsis worldwide. Answer is Group B Streptococcus. Most common cause of neonatal sepsis in hospitals worldwide. E. coli. Most common cause of neonatal sepsis in hospitals worldwide. Answer is E. coli. Most common cause of neonatal sepsis in India. Hospitals हो normal हो, एक ही आंसर अपना. Acinetobacter followed by Klebsiella. Okay, in India, the most common cause of neonatal sepsis is Acinetobacter followed by Klebsiella. Important question है रे, ये याद रख लेना. सरकारी अगला क्वेश्चन ये, और ये किसी को नहीं आता हो ऐसा नहीं है. 10-year-old male African child presents with progressive jaw swelling along with chronic weight loss. FNSC was ordered and histopath is given below, which shows which appearance? Starry sky appearance. Okay, what is the most likely translocation? Diagnosis? As you can see, a rapidly growing jaw mass in African child. It is due to lymph node enlargement. It is a case of Burkitt's lymphoma. Hodgkin's or non-Hodgkin's lymphoma it is. It is a type of non-Hodgkin's lymphoma. इतना तो पता हो रहे Hodgkin's कौन से non-Hodgkin's कौन से. ठीक है, तो it is a type of non-Hodgkin's lymphoma. Please remember, it commonly occurs in children, and lymph node biopsy shows the characteristic starry sky appearance. These stars are nothing but the macrophages which are seen in between, and these are all the blue color sky. It is formed by the malignant cells. ठीक है, so that is important. Translocation B looks like 8. Okay, therefore it is translocation 814. Translocation 28 and translocation 822. जिसके जिसके नाम में 8 आता है, that is all associated with Burkitt's lymphoma. So translocation 814, translocation 28, translocation 822 आ रहा उस पे. हाँ, Staris का appearance in kidney biopsy PSGN, that is post streptococcal glomerulonephritis. Staris का appearance on ultrasound abdomen, snowstorm है वो, viral hepatitis. And Staris का appearance usually on the NCCT head or on MRI head. Neurocystic sarcosis. शाबाश, चलो कोई दिक्कत नहीं है इसमें. हो गया भाई, चलो. Translocation 922, I've told you it is associated with Philadelphia chromosome, associated with CML. Question number 39. A pregnant female presents for antenatal checkup. Easiest question again. She had a history of previous child with Down syndrome and is currently on which therapy? Lithium therapy. Which congenital anomaly? Answer is Epstein's anomaly. Epstein's anomaly is nothing but congenital tricuspid atresia. That means the tricuspid valve on the right side of the heart is not properly formed. Okay, that is congenital tricuspid atresia. Which shaped heart is seen usually? On chest X-ray, you will see the classical box-shaped heart. The box-shaped heart is associated with Epstein's anomaly, and Epstein's anomaly is associated with the intake of lithium during pregnancy. Lithium के side effects फट से. Li stands for increased leukocytes, that is increased WBCs, leukocytosis. T stands for tremors, and tremors are the most common side effect of lithium. That was a previous year question. Most common side effect of lithium is coarse tremors itself. ठीक है. Next, H stands for hypothyroidism. S stands for hypothyroidism. IU stands for increased urine output, that is polyuria. M stands for mother maid should be avoided because it is having a teratogenic risk, that is Epstein's anomaly. कोई दिक्कत नहीं है. तो लिथियम के साइड इफेक्ट लिथियम से ही याद रख लो. Li for increased leukocytes, T for tremors, H for hypothyroidism, IU for increased urine, and M for mother maid should be avoided. Important. Lithium is the drug of choice for. Very good. It is the drug of choice for bipolar disorder, as well as it is also the drug of choice for. अब तुम बोलोगे सर ये क्यों लिखा? Because it is the mood stabilizer, it is only a drug of choice of mania. अगर क्वेश्चन आता है ड्रग ऑफ चॉइस ऑफ acute mania, जब पेशेंट कूद रहा है, then in that condition, then what should be your drug of choice? Either your drug of choice should be atypical antipsychotics, drugs like olanzapine, risperidone वगैरह, or your drug of choice can be benzodiazepines. क्यों? अगर तुमने ये नहीं दिया, वो तुम्हें 4 चाटे मारेगा. याद रखना, वो इतना हाइपर है मेनिया वाला पेशेंट. ठीक है, तो यू नीड टू फर्स्ट ऑफ ऑल स्टेबलाइज द पेशेंट. लिथियम देके उसका मूड स्टेबलाइज मत करो. इंपॉर्टेंट इज नॉट दैट. अक्यूट मेनिया में उसको स्टेबलाइज करो या उसको सिडेट कर दो, सुलाओ उसको, तब तक वो नाचता रहेगा पूरे हॉस्पिटल में. ठीक है, पता चले और 4 पेशेंट को इंजेक्शन ठोक के आ गया. तो ऐसे होते मेनिया के पेशेंट लिटरली. That's the reason why atypical antipsychotics or benzodiazepines are the drug of choice. If lithium is also there an option, together, best answer. Lithium is not an option, single best answer should be atypical antipsychotics or benzodiazepines. No issues with this, anybody? ठीक है, no issues. चलो जल्दी से appearances कर लो. Now, Agon string appearance is seen in transposition of grade arteries, TGA. Aorta is from right ventricle and pulmonary artery from left ventricle. इसको बोलते हैं TGA. TGA is the most specific congenital heart defect in infant of diabetic mother. So most specific congenital heart defect in diabetic mother. Answer is TGA. But most common congenital heart defect. Very good. Most common congenital heart defect in an infant of diabetic mother. Answer is VSD. That is ventricular septal defect. Overall, most common congenital heart defect. VSD. Ventricular septal defect. Overall, most common congenital cyanotic heart defect. TOF. Tetralogy of Fallon. VSD is not cyanotic. Cyanotic heart defect, it is definitely TOF then. Okay, tetralogy of Fallon. जितनों के नाम में T आता है, all are cyanotic. Everything which has T in it is cyanotic. Please remember. Okay, no issues with this. Next is TAPVC, that is total anomalous pulmonary venous connection. Shows which kind of appearance? Snowman appearance. Or which sign? Figure of 8 sign. Or normally all the 4 pulmonary veins open into left atrium. But in this condition, all the 4 pulmonary veins will open into right atrium. Therefore, that is called as total anomalous, abnormal pulmonary venous connection. Next, if 2 of them open into the right atrium, that will be called as partial anomalous pulmonary venous connection, PAPVC. And the sign is known as Scimitar sign. It is known as the Scimitar sign. Scimitar एक तलवार होती है छोटी, ठीक है, उसके जैसा. Coarctation of aorta usually. Which sign is seen? Figure of 3 sign, or also called as reverse E sign. And characteristic, what are these? Inferior rib notching. Inferior rib notching is important to be remembered. Okay? Next, tetralogy of Fallot. Which appearance? Boot-shaped heart. It is the most common cyanotic congenital heart defect. 4 features are: first is ventricular septal defect. Second is overriding of aorta. Third is right ventricular hypertrophy. And fourth is pulmonary infundibular stenosis. Most important is pulmonary infundibular stenosis. It decides the outcome of the patient. याद रखना है बात, ठीक है? No issues with this, anybody? Question number 40. इसके बाद break ले लो भले. A patient was given halothane for maintenance of general anesthesia. He developed muscle rigidity, hyperthermia, and his serum CPK, creatinine, phosphokinase levels were elevated. These symptoms are due to which of the following iron? Important. Provisional diagnosis. Very good. It is a case of malignant hyperthermia. Malignant hyperthermia is a pharmacogenetic disease. What do I mean by pharmacogenetic? हर patient में होगा क्या जो halothane लेगा? No. Only patient who has some genetic mutation. In that patient, if we give 2 drugs, one is halothane and second is shabash. Second is succinyl choline. If these 2 drugs are given in a patient who is genetically predisposed, that patient will cause what? Normally, this is the muscle cell. And the endoplasmic reticulum in muscle cell is known as sarcoplasmic reticulum. That releases what into cytoplasm? Calcium. And that calcium causes muscle contraction. That causes muscle contraction. Usually, important is, please remember this. In this patient, what is happening? All this calcium is going into the cytoplasm. Therefore, there is a more and more and severe muscle contraction, rather a sustained muscle contraction, due to which definitely the patient is having rigidity. The patient is having fever or hypothermia, and his CPK, creatinine, phosphokinase levels are elevated. Classical triad of malignant hyperthermia. Okay, itna hi yaad rakhna hai. Now, what is the drug of choice? The drug of choice is dantrolene. Dantrolene blocks which receptors? Very good. Dantrolene usually blocks the rhinodine receptors, usually rhinodine 1. ठीक है? क्या करते हैं rhinodine receptor? They are the ones which release the calcium. So better is, if these are blocked, will the calcium be released into the cytoplasm? No. Will muscle contraction occur? No. That is how the patient will improve. ठीक है? So usually important is, this has been a question that dantrolene blocks which receptors? Answer is rhinodine type 1 receptors. And which iron is responsible for malignant hypothermia? Calcium is responsible. Take a break, so we'll meet after the break.